Good morning, everybody, and welcome to today's seminar, Arts for Health, Nordic-Baltic Seminar on Arts in Hospitals. My name is Gunvor Kronman, and I'm the CEO of Hanaholmen, the Swedish-Finnish Cultural Center. According to the Constitution of the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. In other words, health is much more than a body deprived of disease. Health is about a meaningful life, about belonging, about relations, about self-expression. As art contributes with meaning, this is a context where art can make a difference. In today's seminar, the morning sessions will look at the topic from this perspective. How is art meaningful in the context of health and well-being? Our keynote speaker, Marcel Forster, is one of the founding members of Jameel Arts Initiative, a global initiative to measurably improve health and well-being through the arts, and a first art project supported by the World Health Organization. In their presentation, Marcel will share with us some early insights from research about how visual art and murals may support well-being for patients, visitors, and healthcare staff in hospitals. Forster's presentation is followed by Kai Lehikoinen, researcher at the UniArts Helsinki, who will look at the topic from a human rights and capacities perspective. The afternoon sessions are dedicated to the perspective of art practice and curating. How do artists and curators see the hospital environment as context from their practice? As the objective of the day is to create a network of professionals working at the intersection of art and health, after coffee break there is time reserved for group work aimed at taking the first steps toward building the network. And I actually just heard that actually Sweden will take the next step after this seminar, potentially, which was really great news, I think. That's the whole idea of gathering like this. So your input today here is really important. This seminar is part of a 3-day program that enables us to take a deep dive in the world of art in hospitals. Yesterday, we met in an informal get-together, and after today's seminar, a bus will take us to the recently opened exhibition, Art Prolongs Life, Prescriptions from the Hus collection at Kunsthalle Helsinki. For our participants from abroad, Hus stands for Helsinki University Hospital, our main partner in organizing the event. The exhibition at Kunsthalle Helsinki highlights the art from the hospitals. We are very happy about this collaboration, and we would like to extend a thank to the Sasta Mountain Foundation and the City of Helsinki for their support. Next, I'm honored to invite a special guest on stage to officially launch today's seminar. Our Minister of Science and Culture, Sari Multala, representing the National Coalition Party. She's responsible for matters convened by the Department of Art and Cultural Policy and the Department of Higher Education and Science Policy. Minister Multala also holds a further vocational qualification in coaching. A 3-time world champion in sailing, Minister Multala serves as the head coach of the Finnish national sailing team in 2013 to 2015. She has held many positions of trust in the field of sports during her sporting career and afterwards. Welcome, Minister Sari Multala, and the floor is yours.
Thank you, Gunvar, and dear audience. It's a great pleasure to be here today and give my greetings to this Nordic Baltic Seminar of Art in Hospitals. I think it's a true pleasure to welcome you to this seminar, which is the first international seminar in Finland on this important subject on art in hospitals. It is a well-known fact that art has a great positive impact on our well-being and health. The role of art becomes even more important when our health requires extra care and attention. Art in hospitals has multiple functions. It improves the well-being of and brings comfort for patients, as well as the family members and other visitors. Furthermore, art can be a means to improve job satisfaction for healthcare professionals. For them, art can uplift and give strength in their day-to-day work. Art can be part of the hospital environment in many ways. Art can be an integral part of the building and its surroundings in the form of various works and art surfaces or a media wall and a sound landscape created in the space. In many Finnish hospital construction projects, art is included in the design in advance. One recent example is the new Children's Hospital in Helsinki, where art is an integral part of the design. To create an environment that promotes the well-being of the small patients as well as their families was a top priority when designing the building. In Finland, we can also be very proud of our vast collection of hospitals' art that HUS Art Committee maintains. The impressive collection includes over 5,700 works of paintings, graphics, photography, sculptures, and graffiti. For our delight, we get the chance to experience some of the artwork in the art exhibition Art Prolonges Life in Kunsthalle Helsinki, that is also part of the seminar program. Dear seminar guests, art plays a very special role when talking about how we can improve hospital environments and the experience of the patients. I'm very pleased that this seminar takes a clear step forward, a Nordic-Baltic cooperation and a professional network dedicated to art in hospitals. International collaboration is of great importance when it comes to capacity building and peer learning. At best, art in hospitals can be a shoulder to lean on. In difficult moments, art may bring us comfort, hope, and sense of meaning. With these words, I wish you all an inspiring day and seminar. Thank you.
Thank you so much for your words, Minister Multala. Dear audience, my name is Aino Kostiainen and I work as program coordinator for art and culture here at Hanaholmen, and I am your moderator of today. And I'm so happy to see you all here in Hanaholmen. I would like to share some practical information with you before we start. A reminder of safer space guidelines: meet all participants with an open mind, respect their diversity, and let everyone define their own experiences. Our events are free from all kinds of discrimination, harassment, bullying, and ridicule, as well as threatening behavior. The Hanaholmen reception desk is available to assist you at any time. And today we will hear 5 presentations from 6 experts on the topic. And between the presentations, there will always be a moment for questions or comments. And if you have a question in mind, please raise your hand and wait for your speaking turn. And you may have noticed that we have microphones that are placed on top of the tables in front of you. So please use those. There's a button on each microphone, and present yourself. And please make a concrete question and use common language so that we all can relate to what you are asking. Thank you. Now I have the honor to introduce to you our keynote speaker, Marcel Foster. Marcel is the Research and Evaluation Associate with Jameel Arts Initiative at the New York University Steinhardt. They also serve as adjunct faculty with the Center for Arts in Medicine at University of Florida, and are the co-founder and co-director of Performance Hypothesis. They evaluate health initiatives for clients, including the US Agency for International Development, Ministry of Health, and the National Institutes of Health. Welcome on stage, Marcel.
Good morning, everyone. How are you?
Good.
Good. So it's an honor to be here. And first of all, I want to give a thank you to Aino for all of her hard work in coordinating this. And thank you also. It's such an honor to follow Gunvor Kronman and Minister Multala as part of sharing remarks today. It's particularly just remarkable to be here with you all today because as you may not have guessed, my father was a Swedish-trained physician. Yeah, believe it. He trained back in Gothenburg, and I grew up hearing all kinds of stories in the States about the incredible precision, kindness, and hospitality of people across Scandinavia. And just in my few 5 days here, I can definitely say that that's been my experience as well. In addition to that, what's also remarkable is, as a child, my father was a single father, and so often when he had to work and couldn't find a babysitter, I would spend time in the Catholic hospital that he worked in. So given it was a Catholic hospital, there were statues of St. Francis, St. Augustine, Virgin Mary. And as a kid, how did I pass time? Well, I would sketch them. I'd sit there for hours and sketch out all these different saints. And so it's truly remarkable to be here in Finland, no less with the Swedish-Finnish Cultural Center, remarking on art in hospitals, given that that was really a critical part of my upbringing. So thank you all so much. And so today we'll be talking about a project that I'm co-directing with Dr. Nisha Sajnani with the Jameel Arts and Health Lab at New York University. And so we'll give you a lay of the land about that research, and then talk about the project itself, the Hospital and Mural Evaluation, or HOME as the acronym, and then do a deep dive across the 4 global sites that we're conducting this evaluation. And then today, very excited to show some preliminary findings with you all, and we'll do my best to make sure we have at least 15 minutes of questions. So let's go ahead and dive in. So the Jameel Arts and Health Lab is a global initiative to measurably improve health and well-being through the arts. We prioritize overlooked and underserved communities, leveraging scientific evidence, artist-led advocacy, and capacity building. Our goal is to integrate arts into public health practice as well as clinical practice. So I'll discuss that today. And we're made up of several entities. You can see the World Health Organization with the European region, Culture Runners, Community Jameel, and of course, New York University, where I am employed. So the Jameel Arts and Health Lab has a huge team. I'm just one of many siloed there at the bottom left. But as you can see, an amazing group of global leaders across arts and health. And then just to note that I'm going to be sharing just one of many different projects that Jameel Arts and Health Lab is leading, and definitely encourage you all to take a visit to the website where you can learn more about these exciting initiatives. So really the question that all of us, I think, have thought about quite a bit is, what can a hospital look like? I think we all have, if you're like me, a hospital looks like lots of long white hallways with Virgin Mary statues. But it can look like more than that too. And beyond that, what is the value that murals and visual arts can bring to patients, staff, and visitors? So we are asking this question, and we're asking this question at 4 hospital sites around the world. The first is Lagos University Teaching Hospital in Lagos, Nigeria. We're also looking at the Children's Hospital of Ljubljana, Slovenia. Looking at Helliston Hospital in Norwich, United Kingdom, And finally, also the hospital called Jacobi Hospital as part of the New York City Health and Hospital System in New York City, United States. So what are our goals across these 4 very different sites? Our first goal really is just to understand the effects that murals have in healthcare settings. As a health evaluator, I was really jumping to let's understand the impacts. We're well, let's first look at the effects since this research is still so new, and we'll talk more about exactly what we mean by effects. The second goal is to collaborate with global sites to gain insights into the impact that these murals have, so the impacts and effects. So what is happening at these different sites? What can we compare? What's culturally specific to each site? Then through that, build a global community, what we're doing right now, building community across the globe with artists and health leaders. And as this is really just formative early research, lay some groundwork into what this can look like for University of Helsinki and all kinds of universities across the globe. So where have we begun? I'll walk you through the processes of this all got started a year ago, and in a year's time, we conducted an evaluability assessment, and we are now wrapping up a scoping review, and data collection across these 4 sites will begin in early January 2025, and of course, that's not possible without protocol development and ethics reviews. So we'll walk you through some of these processes. So an evaluability assessment, that is a very fancy way of saying a pre-evaluation, an early evaluation. Why did we conduct this evaluability assessment? We wanted to understand what mattered to the folks we're working with. So I've mentioned that we worked with 4 different sites. And so we met with artists, site leaders, physicians across those 4 sites and said, what matters to you? If we were to do a big evaluation, which we're doing, what do we need to make sure we collect? What kind of data do we need to collect? And by doing that evaluability assessment, we better understood what to prioritize. But it doesn't just stop with speaking with the folks with whom we're working. We are also conducting a scoping review. So I'm sure a lot of you are familiar with systematic reviews, where you are looking at all kinds of literature and assessing different kinds of methodologies. Well, with a scoping review, we're looking at the breadth of literature that's available. So what's in humanities literature? What's in news reports? What's in medical literature? Anything and everything related to the effects that visual arts have in healthcare settings. And today I'll be able to share with you some preliminary results from that scoping review. Last but not least, we have our protocol development. In working across these 4 sites, we had to work with 7 different ethics review committees. Pleased to pronounce that we have now gotten approval from 5 of those 7 sites, and we're still working through the amended protocols with the WHO, naturally. But very exciting to make sure that, in this case, the evaluation protocols met the highest standards of ethical conduct in collecting data across those 4 sites. All right. So I've talked a lot, and you're more than welcome to just take a moment and address any immediate or burning questions that may have come up before we dive into looking at some photographs of these murals across these 4 sites. So any burning questions about the evaluability assessment or scoping review? One quick question I was curious about was, has anyone here conducted their own kind of systematic review or scoping review related to arts and healthcare? Oh, great. Okay, I'm curious to hear a little more about it if you don't mind sharing.
Hello, I'm Taru Koivisto from University of the Arts Helsinki Research Institute, and here is my colleague Taru Tähti. So we have conducted systematic review on hospital musicians, healthcare musicians' work, And then now we are publishing, perhaps next week, the Finnish Medical Journal has a special issue, theme issue on culture and arts. So there we have conducted a review, and it's a streamlined rapid review. And then I have done some scoping review with Kaile Hikoinen here, and yes, many kinds of. Thank you. I don't know if you asked this.
No, that is exactly it. And so, did I hear correctly? Music in healthcare settings?
Yes, music, and we are also in University of the Arts. We are inquiring all kinds of arts. So we have done reviews on arts and culture and health too. Yes.
Excellent.
So very wonderful to hear you. Please continue.
No, and it was wonderful to hear that this exciting work is happening, and it speaks to the importance, because especially now with this field kind of emerging in terms of what methods do we use, how do we make sure that we're conducting best practice, ethical practice, conducting these kinds of systematic, rapid scoping reviews, all very similar, but all very different in terms of the details of how they're done. It's just critical to really understand the existing data. And so we'll come back to that in the preliminary findings. But thank you so much for sharing that. So a brief glance into what hospitals can look like. All of us will have the really wonderful opportunity to see it with our own eyes later today. But we'll start here with the Lagos University Teaching Hospital. So this is a preeminent tertiary hospital in southwest Nigeria. And they collaborate with an arts organization called the Art of Healing. And the Art of Healing comes from a Yoruba word, Ona Iwosan, which means the art of healing. And they also just go by the acronym TAO. So with TAO, artists collaborate with staff, community members to enliven and uplift spaces. So TAO has shared with us these amazing images of before and after what a mental health care ward, a psychiatric ward for adults, and often these are inpatient psychiatric patients. And you can see that in the waiting room, the before and after, and the transformation. Another just ward common area for the inpatients as well as staff. You can see just a total transformation of before and after. Here you see a hallway of the female psychiatric ward, going just from a kind of drab green to this bright illuminating colors and flowers. And then here, this is one of my favorites. This is actually an inpatient setting. The patients are housed here and dwell here for sometime weeks at a time. And really, you can just see that these monstera plants and plants just completely uplift the area that the patients stay in. And finally, a major change in a hallway, just the ward entrance into here. Just imagine waiting in what was left versus what to right, and just the difference of experience and really the sense of inviting that takes place. So a collage of different artists and collaborators, especially from TAO at the Lagos University Teaching Hospital. And now we're going to glance into the Children's Hospital of Ljubljana. So the Children's Hospital of Ljubljana has a long history of reflecting cultural heritage in their hospital. You can see here there are panels on the outside of the hospital that are from a famous children's author of Ljubljana for this pediatric hospital. And then for patient rooms, they have a separate, very famous Slovenian author and Slovenian illustrator with monkey characters in various patient rooms to just engage the pediatric patients. As part of this long history of visual art at this hospital, a Swedish artist, Anna Runfeldt, who's now based in Ljubljana, Slovenia, and she runs the Nordic Art Initiative, won major funding to continue to transform this hospital. So she commissioned 4 artists. You're looking here at a major external mural on the outside, obviously, of the hospital. It's important to note that this mural that you're looking at is actually what you see if you're a patient inside the hospital. So for inpatients, oncology patients, all pediatric, they get the chance to look outside the window and look at this mural. What's even more exciting about this mural was that when it was originally created, it had an augmented reality app. So you could effectively use the app and look at this mural and interact with the different kinds of animals. And so you can see here the children taking a look and taking a tour of this huge mural. This is the waiting area of the just the entrance into the hospital itself, a separate artist who was commissioned. And then in place of staring at blank walls, a separate, in this case it was a Slovenian artist who created these images of birch trees and different environments reflected across Slovenia. And then throughout the hallways, light boxes, just really humanizing the experience of being a pediatric patient at this hospital. So that's the important work of the Nordic Art Initiative by Anna Runfeldt, as well as the ongoing artwork at the Children's Hospital of Ljubljana. Now shifting a bit closer to where I am from, we're now looking at the New York City Health and Hospitals. And so the mural program with the New York City Health and Hospitals, it began almost 100 years ago in the 1930s during the Great Depression. Our president at the time put forth all kinds of funding to address the Great Depression and was funding artists to work in innovative ways so that folks could have income. So this mural here was by Vertus Hayes, and it was at the Harlem Hospital. As you may know, Harlem is a famous African-American neighborhood and community, and so you could see this. You could see these positive depictions of African-American artists, community members, and healthcare workers in the 1930s. Fast forwarding to the 1980s, Keith Haring. Raise your hand if you're familiar with Keith Haring. Oh, good. This makes me very happy because I'm a huge fan of Keith Haring, and I'm glad to see that he's making waves here in Finland. So Keith Haring was commissioned in the 1980s at the Woodhull Hospital. These images were created in communication with healthcare staff and patients related to the experience of being in the hospital. And it's important to note, I'm sure as many of you know, he did pass away of AIDS. And so it's just remarkable to think about him having such an impact and being impacted by creating this unique and site-specific art piece related to healthcare. And now there are 42 and counting murals across 11 hospitals, as well as a wealth of clinics across New York City. And they take a really exciting approach to murals all over the different hospital. This mural was just commissioned this year by Dister Rondon, who is based in Lincoln area of New York City. So he's a community member of the very area where this mural was created and incorporated images of people from this neighborhood in the image that he created for the mural. You can see here an artist leading a focus group. And so they have a very unique approach to the ideas of the mural are born from focus groups. And then from that idea, they host paint parties where different sections of the murals themselves are co-created by community members, by staff. And it leads to a ribbon cutting moment where the various artists, the artists themselves, all share a moment in celebrating the art that they co-created. And this is an important mural because this is at the re-entry clinic of a Rikers jail. And so this is one of the first things that formerly incarcerated people see when they exit that jail for the first time. And so here we have a mural, and this is one of the first things that they see. And the idea of the mural is to uplift hope and uplift a vision once the formerly incarcerated individuals enter into this clinic as part of it being integrated back into life. And last but not least is this mural here that was created shortly after the COVID pandemic. And it just speaks to the importance of the hospital and the mural itself being a point of celebration during such a dire time. And last, but certainly not least, is hospital rooms. It is important to note that Hospital Rooms is an organization, a nonprofit, started by Neve White and Tim Shaw. This couple, who are really integrated into the arts world of the United Kingdom and London, they had a dear friend who attempted suicide. They went to go visit their friend in a mental health clinic as a result of her attempting to commit suicide. And they noticed that the clinic she was in actually brought down their spirits. The mental health ward that their friend was in to receive care after an acute psychiatric emergency was dilapidated, uninspiring, and bleak. And so you can see here this dilapidated, bleak building. Imagine you're at one of the worst places of your life, and this is where you have to go to experience and process that. So these two artists have been collaborating with artists and communities across the United Kingdom to tell this before and after story of this clinic for mental health care ward turning into this clinic, if you can see it at the bottom. This, I would pay good rent to live here, whereas I would avoid this at all costs. And so another story of transformation is the Hellaston Hospital. At Hellaston Hospital, we will be collecting data. And this was an unused storage room. And so the service users, the healthcare workers at this Hellaston Hospital, were saying that they wanted a space to relax, to have a social hub where they could bring patients, visitors. So it went from this to this, where it's now one of the favorite places for healthcare workers and service users to go bring patients. And you can see here these windows. These images are created by the service users themselves and are changed on an ongoing basis. Here is another hospital, the Springfield Hospital, and you can see on the left here are motifs created by healthcare workers that were then transformed and informed the visual art mural that you're seeing on the right. And another mural, this is an inpatient waiting room. So this was co-created by 10 psychiatric patients, as well as the artist. And here on the left is from the Hellingly Hospital. This is a digital projection. So it's important to be thinking about the fact that when we say murals, we don't merely just mean paintings, but also ceramics, textiles, in this case, digital projections. And then on the right is something that was just rolled out just a month ago, and this is the entryway into a mental health care unit. Last but not least, the hospital rooms. They love telling this story that this general kind of common area, after this was put into place B, the mental health care patients were spending a lot more time in here and took on this pink color as a kind of unification and created their own football team and wear pink jerseys to kind of represent themselves. So these mental health care units, which are often so mired in stigma, it's amazing to think about the fact that this mural played a role in them representing the fact that they are part of this community and these murals being a part of that identity. So wanting to make sure we leave enough time for questions, I'm going to move ahead here. I'm sure we can reserve some questions and answers about these 4 sites. Happy to go to them. But let's talk here a little bit about some preliminary findings from our evaluability assessment that I mentioned, as well as our scoping review. So first, the evaluability assessment. Why did we do that? We wanted to better understand what mattered to the leaders of these 4 sites. So across the 4 sites, we interviewed physicians, arts and murals leaders at each of these sites, as well as artists. So we made sure at least 3 of those kinds of identities were represented in our sample pool. So a total of 18 individuals and leaders were interviewed across the 4 sites, and we used one standardized qualitative guideline to conduct these interviews. After conducting these interviews, we identified 5 cross-cutting themes that emerged. We did have some site-specific themes, which I can answer later, but what kinds of themes emerged across those 4 sites? The first one was what we talked about quite a bit, especially with the New York site, is this idea of co-creating a mural, that a mural is effective, a mural is impactful when there's a co-creation process. And so we called that participatory and culturally competent. I'll come back to that in just a moment. When there is that participatory process in creating the mural itself, you can see that it gets into some less exciting aspects of logistics. Who here has been a part of an art project and you just had a moment of, oh my gosh, I am just leading endless meetings about logistics? Give a raise of hands. Yes, well, we're in that right now with this project too, as you can imagine, with 7 ethics committees. So logistics matter though, and we'll talk about that more in just a moment. But when you factor these participatory processes and these logistic processes, what we found was that there was a creative and social engagement for folks involved. Remarking on Minister Multala's notion and the fact that art can play a major part in staff satisfaction, we see that when there is engagement with staff, that these murals have a higher impact of staff satisfaction, and we'll return to that as well. So here is a schematic, if you will, of these same 5 cross-cutting themes, but represented in a more visual way. So you can see here, on the bottom, at the foundation, we really see the co-creating of murals. That if the intention, oh my goodness, if the intention of a positive effect is desired, there's a foundation of a participatory and culturally competent process. So what do I mean when I say culturally competent? So in Slovenia, I talked about the fact that in the murals themselves is cultural heritage, that so many of the images that you're seeing are coming from Slovenian famous authors that speak directly to the pediatric patients. Another kind of more extreme example is in Nigeria. At some point, an artist was commissioned to create images of like comic book superheroes, right? And the comic book superheroes that were painted were all white Caucasian images. As you can imagine, there's not a lot of white folks visiting a hospital in Nigeria. And so those were then replaced. For what reason? To make sure that there was representation, and so that the patients and the staff saw themselves in the murals themselves. So these are 2 very kind of obvious examples of what culturally competent means, and finding processes that can be as participatory as possible so that the images are reflected in what the staff and patients are seeing. This then leads to conversations related to where do the murals go? How do we maintain them? What materials are used? Who do we engage? Which leads to that center pillar of a creative and social engagement. When these 4 themes are interwoven, it uplifts that top pillar there, which is the intent of a positive, that the murals become and can function as hospital equipment. And that was a really interesting insight from New York, that they don't talk about their murals as as exclusively art. Of course, they have a collection and think of it as visual art, but they talk about it as hospital equipment, that it impacts the patients the same way surgical instruments do. It impacts staff the same way the hand washing stations do. And when there's this participatory process, it can have this really impactful hospital equipment function. So in addition to that, we have our scoping review. So we'll be submitting this in December for publication. But quickly want to just share that the eligibility criteria for our scoping review was a healthcare setting. It could include any kind of participant. So really what that came down to were staff, patients, and visitors. And it could be any kind of visual art program. There are a lot of murals we've already found out there that were described that were using different words. Big paintings, visual projections. So we didn't want to limit the scoping review just to murals and included any and all kinds of visual art. And finally, the studies had to have some kind of connection to our definitions of well-being, wellness, or belonging. So that was the eligibility criteria. When we first ran the research, it came out to 18,000 articles. Luckily, we were able to automatically remove the duplicates, and we had to review 11,000 titles and abstract. So luckily, very privileged that we have a team of almost 10 students who helped review these 11,000 articles, and we brought it down to 116 full documents. You can see here that we then, from those documents, continue to exclude. You'll see the first thing, which I'm sure a lot of you, and so to my demise here, we had to only include studies that were included in English because across our 10 reviewers, not one reviewer shared a second language. So I speak Swahili and French and English, and not one other reviewer also spoke English or French or English and Swahili. We had other reviewers who also spoke Mandarin, but we had to have 2 reviewers for each piece, and so that limited us to English. But in addition to that, after reviewing 116, we identified 60 total studies that speak to the eligibility criteria that we laid out here. Of that 60, 29 are from peer-reviewed literature sources. The other 31 are from what we call gray literature, which includes documents that are published but not necessarily peer-reviewed. So that includes conference proceedings, abstracts, as well as news reports and other media. We felt that was particularly important because we understand that a lot of hospitals and arts organizations may not have the resources available to be able to publish a peer-reviewed manuscript. So across these 60 articles, we identified these are the different regions. You'll see that most of the regions came from the European region, 2 from Norway, 1 from Denmark, and then 18 of those 27 you see there from the United Kingdom. And then also 2 from East Asia, 3 from Palestine, from the Middle East and North Africa, Palestine, Libya, and Egypt. We also were able to find a news report from Nigeria, and then 3 from Australia. As a result, I'll have to say this morning, I was introduced to a new abstract that we may have to include because it includes an English abstract by Hanna-Lisa Liikanen. So perhaps we'll go from 60 to 61. So thank you for this. All right, so what have we found? Just some preliminary outcomes here, and we're jumping to some outcomes, and I'm, for this presentation, only including our peer-reviewed, because we certainly don't want to. I will share with you here that there was one blog from our gray literature where the author shared that the visual art cured her cancer. This is not an outcome that I would share in a medical conference, but at the same time, given this is a scoping review, we don't want to exclude the experiences of people who share this. But of course, we make that very different from our medical peer-reviewed literature. So from our medical peer-reviewed literature, 2 studies here that related to patients. The first took place there by Lone, was the last name of the author, in 2021 in New York, in a city called Buffalo. They interviewed patients who had to undergo major oncology surgery and were essentially stuck in an inpatient setting for over a week. And so they implemented a visual art program to see if there was a reduction of anxiety. And they did find, using validated scales, that there was a reduction of anxiety as well as increased sense of hope for these patients who had to undergo major oncological surgery. Also, and then in Rochester, New York, a study looked at hematologic cancer in patients. So 2 kind of inpatients who had long lengths of stay, and found that what they did is they had an actual intervention of bringing on digital screens visual art and sharing it with these patients who were undergoing oncology in these inpatient settings, and found that there were a major 85% reported a positive distraction from the anxieties and the pain that they experienced being in this oncology center, and also reducing anxiety. So in 2 different studies, both related to oncology, we're seeing that there's a reduction of anxiety. My father, who just underwent 12 treatments of oncology this past year, he's doing okay, thank goodness. Finding these moments of finding ways to reduce anxiety is so critical. And so it's exciting to see these 2 initial outcomes. Again, to Minister Multala's point, it's so important to incorporate staff satisfaction. So we have 3 studies here. The first from Mendelsohn, this took place in San Diego, California, a really fascinating intervention where patients were asked to bring in photographs from their home and place it at their bedside. The photographs were then used as a kind of intermediary piece between the healthcare worker and the patient. So these were cardiology patients, intensive care unit patients, and palliative care, end-of-life term care patients. And so the photographs were found to have, using a validated scale, greatly increase a sense of connectedness and belonging among the staff at this hospital, and bringing meaning to the work that they did with the patients. We have Saarinen. Unfortunately, Saarinen is based in Nevada, but perhaps her ancestors were from Finland. But Saarinen found in her study, this was a really interesting peer-reviewed piece where she provided first accounts of her work as an artist and a nurse, and found and reported that in her work as a nurse in this peer-reviewed piece, that that the healthcare providers found staff satisfaction by the work that she implemented in her hospital. Finally, a piece from Australia. This piece was fun for me to read because it looked at Catholic hospitals. It looked at Catholic hospitals across 75 hospitals in Australia, and reported using surveys and interviews that patients, visitors, and staff greatly experience a sense of connection with one another as a result of the art. So these are very preliminary findings. We'll have more to share very soon. But really, the scoping review will be submitted before Christmas. Gosh darn it. And we'll have be happy to share those preliminary and these outcomes with you in more detail. We will hope to begin data collection in January, February, wrapping up our ethics review processes, and hopefully more presentations to come. We are doing interviews, we're doing surveys, and we're using Photo Voice. Raise your hand if you've heard of or know of Photo Voice. All right, so photo voice, I see a hand go up. It is an exciting arts-based method where you provide a prompt. So we could do a photo voice today, where I could ask all of you to take a photo of something that inspires you. Could be anything. And then you would take that photo, upload it to one place, and then, in this case, Aino would analyze those photos and say, aha, it looks at Hannah Holman, what inspires folks are, I'll just take a guess, the beautiful visual art. I'm clearly biased here. The visual art that's outside and the sculptures. So we need to invest more in these sculptures. And so it's a way of collecting data through art, through arts participation. So we're using photo voice, surveys, interview, mixed methods to understand the impact among patients, staff, and visitors across these 4 sites. Last, and I'll go ahead and say most importantly, we'll be hosting communities of practice. So we'll be sharing more information. I really hope to see all of you there. And really, I might tap some of you to share some of the work that you're doing, the rapid review that we heard about, this incredible work that maybe Hanna-Lisa Likkonen, we can hear from you and the pioneering work that you did and are doing. And so these communities of practice, and keep up the dialogue. So thank you for your attention today. As my father taught me to say, tack så mycket, and ja, kiitos paljon.
Thank you so much, Marcel. What a robust and inspiring presentation. Now we have some time for questions or comments. Are there one? Does anybody want to comment? Well, I'm actually curious about the evaluability assessment and the scoping review and the outcomes. Was it were you at all surprised with the outcomes, or was it anticipated, or how was it like in relation to your expectations?
Yeah, I would say I'm so happy we decided to do a scoping review opposed to a systematic review. A systematic review is really looking very specifically at methods. So if we had done a systematic review, we would have really limited ourselves only to peer review literature. And we would have just found like 5 articles. In this case, with the 60 that we found, even among those peer-reviewed literature, even among what I shared today, you saw just the diversity of interventions that took place, bringing photographs from home, showing digital projections in an inpatient setting. So really, I was surprised to see the diversity of how art was showed. I think also we really did our best to not be conservative in our definition of visual art, and we did include a few pieces that never use the term art. So in one case, it was a pediatric setting, and they had a projection, a video projection that the patients could play with while they waited. And so I was just really excited and surprised by the diversity of interventions across the 29 peer reviews.
Thank you. Gunvor had a question, and then...
Yeah, thank you. Very fascinating lecture. Thank you so much for that. I was a little bit interested in, since you have 4 different locations that you are looking at as well, is it possible to detect some cultural differences in how art is perceived by patients? And then I was especially interested in your small remark on also having the peer review on Palestine, since I'm chairing a hospital in Jerusalem for Palestinians. I would be very happy to talk to you about that afterwards. Thank you.
Yeah, would love to talk about that. So yeah, Abu Lawi in 2019 published the article, and it's a pediatric hospital in Palestine. And I think the 4 hospitals, without question, there's going to be different cultural differences, and that's why doing mixed methods is so important. The goal with the survey, we're using validated scales. We do hope to put forth generalizable findings that speak this is the effect of murals across sites, irrespective of culture, right? We're hoping to do that with survey. But even I say that, and in our surveys, there's a demographic section, and there's questions related to gender and race and ethnicity, and they're of course so different. So in Nigeria, the question of ethnicity, we have Yoruba, Igbo, the tribes and ethnicities of Nigeria. In the UK, it's 20 different categories. And by no means would we ever try to make the demographics and even gender questions at the New York City Health and Hospitals, they require any survey to include transgender male to female, female to male, non-binary, gender questioning. And then we're not asking that question. It's just male, female, other in Nigeria. So respecting cultural norms related to demographics, but all of the other questions come from validated scales, so we don't touch that, of course. But in the interviews, of course, we will see culturally specific themes, and there will be themes that emerge that are only specific to that site, and that will also come up in the photography, in the photo voice. So I think the mixed methods will really help us to iterate what is shared and then also what is not shared, and both are so important. So thank you for that wonderful question.
And yes, Mark, please.
Is this working now? Yes. Thank you, Marcel, very much for this highly inspirational talk. My name is Laura Huhtinen-Hilden. I'm the leader of Cultural Wellbeing Research and Education Center in Finland, launched by Metropolitan University of Applied Sciences and University of Jyväskylä. And I'm especially interested in your findings about how, because arts in general has very much seen also as something that affects and those receiving or being kind of experiencing it are more passive. So I was really fascinated about the findings, how this creative and social engagement was part of that. So could you elaborate on that? It was very interesting.
So from our evaluability assessment, that was just something that kept coming up, and it came up in different ways, speaking to Gunvar's great question around insights that are not the same across the different sites. But and it was coined in different ways. In the story from Nigeria about the fact that there were Caucasian images of superheroes in a Nigerian hospital, and those were changed. In Slovenia, they really honed in on the term cultural heritage. In the UK, there was an artist who talked about the fact that he doesn't really come to the mural creation until he first touches base with community members. And then New York City, they just have a system in place. So it came up in very different ways, but it really just spoke, again, to this notion of what we coined culturally competent and participatory. That and there was one article in the scoping review where it was case control, and they had a hospital with murals and a hospital with no murals. And it was an area that it was pharmacists. And so it was staff only in a basement, no windows. So, yes. So they were hoping that these murals would have a positive impact for staff. And so the intervention was they just put up a bunch of murals. This was in, I think, Vancouver, Canada. And ultimately, there was no big difference between the case and the control. And in the findings, in the discussion section, the biggest lesson learned they talked about was, the staff had said, well, why weren't we asked about what murals needed to go up? Why weren't we informed? And it was just a bunch of images of like ferns and trees. And, a lot of the staff members didn't even notice it. And so that process from idea to implementation, it changes the experience of what you're seeing. And so hope that gives you some insight.
Then we have a question from Kim.
Thank you for your presentation. That was excellent. My name is Kim Morgan. I'm a professor from Canada at NASCAD and also a doctoral student from Estonia. And my research is in public art in healthcare facilities. I'm a site-specific installation artist, and it's been my process to both as a teacher and as an artist to actually do field research first and then propose sites that wouldn't be considered just because the scope isn't in anyone's vision. Has there been any consideration to actually having artists that work in site-specific installation actually doing some field research on these sites and coming up with locations that hadn't been considered as opposed to status quo, for lack of a better word, but yeah.
Yeah, no, I think that's a great question. So for our data collection, and let me see if I answer your question correctly. For our data collection, we're only looking at murals that exist. You know, we'll do some baseline research related to the process of how those murals were created. In some cases, I think that a lot of these murals did have that process of field work. So, for example, I think especially in Nigeria, across many of the sites, the location of the mural is determined as a result of focus groups, as a result of input from staff, visitors, community members. And then the images of the mural are determined by these engagements, these what I've called participatory and culturally competent processes. So my hope is that participatory and culturally competent processes in some ways relate to this notion of field work and doing some due diligence before a mural goes up. And I think, you know, to your point, in our evaluability assessment, we found that if you preclude that process, really wonky things happen. Murals go up where people don't see them, or materials are used that fade away, or the process of getting the mural up gets delayed as a result of not engaging a stakeholder. And so in this case, all of the murals that we're looking at mostly followed that process. And so, and again, we're only looking at existing murals. And I think, especially when we were doing the evaluability assessment itself, it's like, my goodness, we could do a whole research initiative only on the process of creating a mural, right? In this case, the funding was talking about what are the effects of existing murals, right, as a result of viewing them. So I hope that addresses your question. Yeah, thank you.
Yes, maybe first. Yes, Mr.
Yes, thank you for your presentation. My name is Markus Lähteenmäki. I'm part of the HUS Arts Council, and I was interested in this media of murals as well, because in our work we've been moving away from murals thinking that hospitals are actively changing environments, and murals as a fixed feature is not very good at that. So I wonder, for example, that like a Keith Haring mural is actually quite a pain for the operation of the hospital from a heritage point of view. So I wonder if this is something you've worked with as part of your research.
Yeah, that's a great question. The care of the murals and the costs that go into that. That did come up, especially with the New York City interviews. And so I think in the case of New York City, you know, Keith Haring is cultural reflection and is a reflection of the city and the history itself. So I think I do hear that concern, and I can understand. And in one case, we were hoping in Nigeria to not only look at the psychiatric adult ward, but also the pediatric ward, because the pediatric ward, as I mentioned, had all these murals of superheroes. Well, the pediatric ward got totally renovated, and the murals were removed as the result of the renovation. So I think that with anything, with art, there is impermanence. And, because a mural is put up, it may not necessarily stay forever. And it does kind of depend on on those logistic factors, on the participatory factors. And so in some cases, a mural might get taken down, it might get painted over. And so the question then becomes, we'll come back to Keith Haring, if it's a mural that has quite a bit of importance to the staff members, quite a bit of importance to the community, what are processes to explore new ways of expressing that visual art? If, from a logistics standpoint, a mural costs more money to uptake, what are alternatives? In our case, a mural is not merely a painting, right? It's also can be a textile that's hung, and a textile can be moved. It's also video projection. It's also major screens. It's also ceramic tiles. So I think that you do bring up a really important point related to maintenance and budget, and I think especially in healthcare settings, every dollar matters because every dollar is related to ultimately patient outcomes. And so certainly I can respect the decision that a major painting, especially if it's someone like a Keith Haring, that then becomes its own kind of monetary asset that must be maintained, must be preserved for different reasons. And then that ends up costing me maybe more in terms of budget. And that's something to weigh and something to consider in those logistic factors. So I hope that does address your question, and I appreciate that concern.
We had one question there, please.
So thank you very much. And from this very visual presentation, I think it's very important that we all add in different ways to this shared resource of knowledge building and policy making also. So what I was thinking, I really liked when you talked about the outcomes and the findings, what you have done here in this project. So, and this intent of positive effect, so to uplift well-being. So I was thinking that what about when the intent of positive effect does not happen? If you think about that from a little bit more critical perspective. So do you have some kind of indicators already, or are you thinking to take in this project that kind of aspect? What then? Because my research was from musicians who go to hospitals and healthcare settings, and we worked in Espoo Hospital, which is emphasizes the care of aging people, and there Espoo Hospital works with Emma Modern Art Museum. So it became apparent that I didn't report it in my study because it was about these music makers, but it became apparent that, for example, if a person is inpatient in a hospice care or palliative care, so they may be a little bit nauseous and have many kinds of that kind of issues. So they had to take, if the art was very modern, they had to take the art out of the ceilings, or how do you say it in English? But yeah, this was just a comment or question. Did you have any this kind of indicators if the intent of positive effect does not happen?
Yes, absolutely. So not included in the preliminary findings today were negative and or null findings. So I spoke a bit already on one study that found null findings between the case control, and but there were negative findings as well. I brought up this question last night when we were speaking, and so we took a deep dive into the articles that had negative findings. And there was one, it was from one study that comes to mind, I don't have the author right off the top of my head, but it was a qualitative, interviews. And the qualitative interview talked about the fact that there was one painting, perhaps similar to this, that had splashes of red paint. And there was, I think, a staff member who said it reminded them of blood and it kind of scared them. And so, and I think a separate research study are what are the effective aesthetic kind of guidelines across these four sites? Not that these 4 sites represent everything, but all of the site leaders have hinted at the fact, and this is a bit out of scope, so we don't have rich data on this, but they've hinted about the fact that, not all art. So, we certainly would hope to not see Goya black painting, right, in any hospital that we go to. I certainly would hope that I don't see that. Or I went to the Gothic exhibition at the Ateneum in Helsinki. Oh, my goodness. A lot of those paintings I saw, I would hope to not see in a hospital, of the Edvard Munch deaths and what have you. So, yes, I think the short answer is that a lot of the qualitative findings did kind of speak to that fact of the art was irritating, the art was annoying, I didn't like it, and even the most beautiful of art and uplifting of art, not everyone's going to like, and there's going to be that component of it as well. But I think overall, so I think in the scoping review, we will have a section around negative outcomes. But in the case of our scoping review, there was not one study that only had negative outcomes. It was mixed, and there were null findings, negative findings, positive findings. And it really speaks to the importance of continuing to do this research, because we're really just at the beginning and trying to understand, what best practices are in place. So, and the negative findings are so important, and I'm really spending a lot of time looking at those, because, from an ethical standpoint, it would be just egregious to say, oh, the murals are across these 60 studies, they're just helping everybody. No, I'd say across the 60 studies, I think we identified around 10 negative findings. And again, they were intermixed with other findings, and mostly from qualitative studies where you see quotes. But I appreciate that question.
We have still time for one question. Finbar, did you have a question?
Not a question exactly, more a reflection just on one of the issues that you brought up earlier and that was brought up by our colleague there. An issue about maintenance and the logistics of murals and so forth. I work at Region Stockholm, and in one of our hospitals we have a large number of murals that were painted in the 1970s. And they're painted directly on the walls. The artists in question are still active. They're all in their 70s themselves now. One of the things that we have to constantly do with those murals is to, on a regular basis, bring those artists in to repair and do some maintenance on them. Maintenance can often be quite a neutral kind of just something that has to be done. But one of the things that we've found is, as a bonus effect of these artists coming back, is that there's a lot of re-engagement with the works themselves. Having those people on site to actually maintain these things, to care for them. We found that a lot of the healthcare staff on site, respond really well to it. It brings up new, I suppose, gives them a new perspective on what they're doing. So as I say, not a question as such, but I think that maintenance issue can be, it doesn't just have to be like a boring logistical process, but it can actually be quite, good for the context in general.
Yeah, I appreciate that, and I was thinking a lot about that important point and question that this gentleman brought up. And, in New York City, where they are maintaining a Keith Haring mural, for goodness sakes. I'm sure developers come in there staring at it, hoping they can create some new site-specific piece. I think that, again, for New York City Health and Hospitals, they coin that the murals and the visual art are hospital equipment. And hospital equipment costs money, but hospital equipment has a return on investment, that you buy new surgical tools because you have to make sure that it's hygienic, and that by maintaining high quality hospital equipment, you do spend money, but there's a return on that investment. There's a return on the patient outcome, staff satisfaction. I think the other component for New York City, and I think you're speaking a bit to this, is that New York City, they are really investing heavily in the arts as a result of burnout, healthcare worker burnout. Unfortunately, the statistic in the States is that every day there's now a suicide by a physician as a result of burnout and fatigue. And so they are investing all that they can in addressing this epidemic. And one of the many strategies, I'm not ever suggesting that the cure to physician burnout or healthcare worker burnout are putting up murals, but one of several strategies is making sure that that the workplace is an uplifting place to be, that the windowless hallways, the fluorescent lights are met also with images that have a reflection of them. And I think I really appreciate your point related to how maintenance can be an uplifting experience, that artists get to come back to something they created decades ago. And I haven't quite thought of that and appreciate that insight and nuance, especially related to the evaluability assessment. So thank you.
Thank you so much. So many brilliant questions, but now we have to move on. So thank you so much, Marcel. And the good news is that this session will be recorded, so there will be a video available at our website afterwards, so you can come back to these conversations. But now I have the honor to welcome Kai Lehikoinen, a university researcher at UniArts Helsinki's Research Institute and the Researcher Network Educational Research in the Arts. His research centers on arts and social engagement, cultural well-being, and expanding professionalism in the arts. His recent projects include integrating cultural well-being into person-centered elderly care, among others. Warm welcome, Kai Lehikoinen.
Good morning, everybody, and thank you to the organizers for the invitation. It's a pleasure to be here. Before we start, please stand up. You have been listening for a while, and you deserve a break. It was a brisk morning when I walked here this morning. I saw the first puddles with a thin layer of ice, knowing that in the next few days there will be snow eventually. So imagine yourself seeing the first snowflakes coming down and just follow them with your eyes. Imagine the first snowflake that you can see, and it's coming down. And let your body sort of resonate with your focus, just swaying a little bit when you observe it coming down gradually, and the second one there, and the third one there. And you just want to be that 5-year-old kid who wants to touch it, take it, catch it, and with the other hand, just see the different directions when they are coming. They come behind you, and just try to grab them. Catch them when they land. Now try to catch it with the tip of your head. You can move a little bit with your feet, let your knees be soft. Try to catch it with your nose. And another one with your nose. And the best one with your tongue. Stick your tongue out. Yes. You should have seen yourselves. Look good. Great. Please sit down. So, my name is Kai Lehikoinen. With a background in dance pedagogy and dance studies, I'm a university researcher at UniArts Helsinki. And I worked in the arts and higher arts education for over 3 decades as a dance pedagogue, choreographer, regional artist, and researcher. For more or less 20 years, I've focused on socially engaged arts practices and their potential in diverse contexts, including health and well-being. From 2015 to 2021, I worked as a Deputy Director for Arts Equal, a 6-year multidisciplinary research consortium. The project, funded by the Strategic Research Council of Finland, aimed at transforming the arts and arts education systems in Finland to promote equality, accessibility, and well-being, and to dismantle mechanisms of inequality in the arts and arts education services. In Arts Equal, my research team focused on the arts and well-being in health and social care contexts. Some of my researchers are here, as you noticed, Taru Koivisto and Taru Tähti. Their doctoral dissertations in the project contribute remarkably to our understanding on art and music in health and care context. I'm very proud of their work. Our work builds on and expands on what our pioneers in Finland in this field, Hanna-Liisa Liikkanen, Laura Huhtinen-Hildén, Pia Strandman, and others, Mari-Liisa Honkasalo and Hannu Salmi, have established. Since Arts Equal, I collaborated with the Care Science Department at Åbo Akademi University to integrate ideas on cultural well-being into person-centered care for the elderly in the Creative Person-Centered Care Art Project. And more recently, I collaborated with the House of Effectiveness, a multidisciplinary network of welfare and health-related effectiveness research and education at the University of Eastern Finland. We investigated the development of evaluation methods to assess the economic impact of cultural well-being activities in Finland. The project was funded by the Prime Minister's Office. Today, I'll discuss cultural well-being through a human rights and capabilities lens, focusing on the conditions needed for it to thrive and the essential role of personal connection to art in this process. Scottish philosopher Alistair MacIntyre, his quote highlights how storytelling is crucial to our understanding of our cultural embeddedness. By asking, what stories am I part of? He invites us to reflect on the stories and cultural contexts that shape our identity and actions. This points to how our understanding of ourselves and our moral choices are closely linked to the larger stories and cultural frameworks in which we find ourselves. It is therefore important to identify and engage with the stories that influence our beliefs and values in everyday life and at work to better understand our cultural embeddedness on a personal level. Next, I invite you to reflect shortly the following questions. What stories or values have shaped my identity and influenced my decisions? Can I identify specific stories that have influenced my view of others and the world? How do my family and community stories influence my perception of different groups of people? And why are these stories and values important in our work when we encounter different groups of people? Histories and values are not neutral. They're not natural. They are not universal. As pointed out by philosophers such as Michel Foucault, Judith Butler, and Gayatri Chakravorty-Spivak. They are shaped by our cultural and historical contexts, marked by power relations and hierarchies that can marginalize some perspectives and favor others. Recognizing this is crucial to creating a more equitable and inclusive environment and society, whether in hospitals or elsewhere. The beginnings of, it doesn't move. There. The beginnings of culture are complex and often contested. In cultural studies and history, the origins of human cultures are commonly traced back to the emergence of tools and symbolic expression. Artifacts like cave paintings and carvings that show early signs of human creativity and communication. For instance, ancient petroglyphs found in Portugal's Coa River Valley, dating back 20 to 30,000 years, reflect early forms of artistic communication and human interaction with nature. Additionally, paths and plantings in the valley reveal how human lifestyle and behavior can shape and leave lasting marks on the natural environment. Of course, with the climate crisis and pollution of oceans, we are acutely aware of this. Similarly, the human body itself is profoundly shaped by cultural forces. Misty Copeland's book, Ballerina Body, demonstrates how the aesthetics of ballet carve body ideals through disciplined training and strict dietary habits. But of course, you don't need to be a ballerina to have a culturally shaped body. We all live in bodies influenced by cultural norms and habits, from aesthetic ideals to lifestyle diseases. Social and cultural factors partly shape conditions like obesity and diabetes. The evolution of culture is linked to language development, social organization, and the establishment of shared beliefs and values. The transition from nomadic hunter-gatherer lifestyles to settled agricultural communities is considered significant as it led to the development of art, rituals, and the creation of distinct cultural identities. In contemporary cultural studies, the term culture encompasses a diversity of beliefs, customs, languages, arts, and social norms that shape human behavior and interactions within different societal and historical periods. In other words, culture is a defining aspect of human identity. Without culture, an essential element of what makes us truly human is absent. Sociologists such as Pierre Bourdieu, Irving Goffman, and Kenneth Gergen have explored the concept of cultural embeddedness, highlighting how social interactions shape our identity within specific cultural contexts. Through these interactions, we embody cultural norms in our behaviors, dress, and daily actions. Culturally specific ideals and values deeply influence how we perceive ourselves, how we perceive others, and the world. Bourdieu introduces the term habitus to describe the habits, dispositions, and preferences we unconsciously develop without our social and cultural environments. This habitus acts as an invisible hand, guiding our thoughts and behaviors according to our background. Ultimately, cultural embeddedness and habitus shape not only individual identities, but also attitudes, lifestyles, and even health and well-being, reflecting the deep connections between culture and the human experience. In 2014, The Lancet published an article by David Napier's research team titled Culture and Health, highlighting how cultural values and traditions shape health and behavior. Further, the diversity and dynamism of modern society create ever-evolving needs, such as varied diets, lifestyles, fashions, and recreational activities. that traditional healthcare systems struggle to address or keep up with. However, the cultural dimensions of health and well-being and cultural well-being can be overlooked in hospitals and other healthcare service organizations that focus on medical treatments and operational efficiency, and where health is still frequently defined in strictly medical terms, risking an oversight of well-being's cultural dimension. This gap stems from binary oppositions in Western thinking, where science is viewed as objective and culture as subjective, resulting in limited cultural understanding within the medical sciences that dominate much of the healthcare discourse. Napier and his colleagues emphasize the importance of understanding the cultural context of health and well-being and challenging the preconceptions about it. When we discuss culture's impact on health and well-being, we refer to the concept of cultural well-being, which can have several meanings according to Lilja Viherlampi and Rosenlöf. It can be used to describe how culture and the arts communicate meanings of health and well-being, influencing individuals and communities. It can also refer to the broader ecosystem or sector of cultural well-being where arts, culture, education, and social and healthcare sectors collaborate to create practices, content, and knowledge that promote well-being. Most commonly, however, cultural well-being refers to an individual's perceived experience of how culture and the arts contribute to their sense of well-being. The image here illustrates the cultural well-being ecosystem. Research, practical expertise, communication, and education influence social values, political will, governance, and funding. These factors then impact structures, resources, and practices in the arts, culture, education, and health sectors, ultimately enhancing access, participation, engagement, and perceived well-being. But how does participation in the arts relate to cultural well-being? The arts are a unique and essential part of human culture. Their role in cultural well-being is multifaceted, encompassing diverse art forms such as performing arts, literature, visual arts, music, film, architecture, and design. And this list is constantly evolving as new artistic disciplines emerge. At the heart of all arts are imagination and creativity, shaped by historical and cultural ideas of artistic creation. Art and cultural experience evoke a wide range of emotions, pleasure, joy, surprise, anger, that stimulate critical and creative reflection, enriching our lives. Philosopher David Best argues that reflecting the arts, we gain new experiences and perspectives that deepen our understanding of ourselves, others, and the large questions of life. Today, the arts are more diverse and accessible than ever. They are associated with varying interpretations of art and artistry. And these different meanings not only coexist, but also create tensions, particularly between traditional and more contemporary views of art, with the social turn that has influenced since the late 20th century. In a democratic society, diversity and multiple perspectives in art are highly valued. Inspired by the ideas of John Dewey and Barend van Huysen, I see art participation as an essential part of everyday life and social interaction, where art gives expression to experience and promotes learning and understanding of the world. David Best writes about how artistic processes and works evoke thoughts and feelings deeply rooted in culture and language, emphasizing that interpreting art is a dynamic interaction between the artwork and the participant's cultural and linguistic background. These ideas come to life when looking at, for example, Louise Bourgeois' sculpture Mama at the Guggenheim Museum in Bilbao. Through this work, Bourgeoisie reflects on her mother's strengths with the metaphors of spinning, weaving, nurturing, and protecting. This artwork inspires me to reflect on the meanings of social networks and caring in an increasingly uncertain world. Someone else would interpret the work differently, and that would be the start of a stimulating discussion. Before the recent parliamentary elections, Riikka Purra, now Finland's Minister of Finance from the populist right-wing Finns party, described culture as a luxury service that Finland cannot afford. The government is now planning a 17.4 million reduction in the culture budget for the coming year. Purra's statement overlooks the broader impact of the cultural sector, which, despite comprising only 0.8% of the state budget, plays a vital role in both Finland's economy and social fabric. These cuts are likely to harm employment, the experience economy, and cultural exports, while undermining equal access to cultural rights and cultural well-being. Art and culture have always been central to Finland's national identity, social cohesion, and independence, as recognized by the government resolution on society's security. Supporting these sectors is essential for building and sustaining a strong, resilient, and independent society. Art has many roles in society, and its primary role, of course, is to be art. Like basic science, art does not need any interests, any goals or benefits outside of itself. However, art can also have a social function, such as challenging prevailing values, norms, morals, behaviors, stereotypes, and power. Art is an ever-changing and distinctive form that encompasses a variety of phenomena, most of which have nothing to do with health or well-being, nor do they have to have that. Many different things motivate people to create art, and therefore the debate on the value of art should not be reduced to a debate on the effects of art on health and well-being only. However, this does not mean there is no connection between art, well-being, and health. And the debate on these connections has been around for a while. The healing power of words was recognized in ancient Egypt over 3,000 years ago. The philosopher Plato addressed the discussion on the relationship of art to society and its impact on citizens in his book, The State, around 2,500 years ago. In his book on poetry in ancient Greece over 2,000 years ago, Aristotle described catharsis, the purging of emotions of pity and fear that are aroused in the viewer of a tragedy. A sudden emotional climax in the play brings an overwhelming sense of renewal, a new life to an audience. Shamans from different cultures have also been linked to art and healing. So the interests in the links between art, health, and well-being is not just about recent political agendas such as neoliberalism, but also has deep roots in the history of Western thought. And it is also about the need for cross-sectoral cooperation in an increasingly fragmented society. Over the last quarter of a century, research on the impact of the arts on health and well-being has grown gradually, and practices and recommendations have been developed both in Finland and elsewhere, particularly in the Nordic countries, the UK, Australia, New Zealand, and the United States. Today, several academic publishers are publishing books on art, health, and well-being. Likewise, this new and rapidly growing field of research has attracted the interest of several international scientific journals. Alain de Botton and John Armstrong write about art's health-promoting properties that can be experienced as therapeutic without being art therapy. Art can make people feel better and healthier, positively affecting their body and mind. The Botten and Armstrong identify 7 functions of art linked to this therapeutic quality. It helps memorize, gives hope, supports the process of grief, provides balance in life, nurtures self-understanding and personal growth, and contributes to an appreciation of life. In the World Health Organization's scoping review, Fancourt and Finn identified many contexts for the health impact of the arts. This include what you can see here, everything from child development to weight loss and weight management, diabetes management, mental health, post-traumatic stress, pain management, and so on, to age-related frailty, rehabilitation, prevention of premature death, palliative care, and grief counseling. Extensive evidence show that participation in the arts positively affects physical, mental, and social well-being, enhancing self-image, emotional resilience, immune function, and social cohesion, while also supporting mental health and fostering empowerment and empathy. What makes art so effective? According to the World Health Organization's report, the positive impact of the arts on health and well-being stems from its multi-channel effects. The arts combine numerous health-promoting elements, including engagement in the aesthetic activities, imaginative expression, sensory activation, emotional engagement, cognitive stimulation, social interaction, physical activity, as well as participation in health-related themes and interaction with healthcare settings. And these diverse engagements explain why the arts are especially powerful in enhancing well-being across a range of mental, physical, and social dimensions in different age groups. And while the arts are frequently linked to positive effects on health and well-being, critics argue that this approach may undermine the art's intrinsic value, as highlighted by scholars like McQuilton, Reisinger, and others. Some view the arts to serve external, measurable outcomes, a concept known as instrumentalism, which critics argue can reduce art to a utilitarian tool rather than preserving its independent cultural worth. Furthermore, there are scholars characterizing arts initiatives for well-being as potentially an elitist luxury that is predominantly accessible to the privileged few, raising questions about whether these programs can effectively address sort of large-scale global health concerns, such as basic needs like clean water, food security, equality in health and education, and so on and so on. Critique also extends to the quality of existing research on arts and health, and this is why these scoping reviews are particularly important, because they help us understand sort of the quality of existing research. There are methodological concerns such as insufficient evidence, potential overestimations, and difficulties in establishing causal relationships amid confounding variables. Some studies have been associated with oversimplifications and broad generalizations, leading to imprecise claims about arts effects. Moreover, certain claims may reflect neuromyths, misconceptions about brain science and the arts, which further complicates the field of credibility. This particularly in popularized publications, and especially here in Finland, presumably. Given these critiques, researchers advocate for more rigorous methodologies to better understand how the arts impact health, access effective approaches to diverse populations, and examine any potential risks to health equity and well-being associated with arts initiatives. Now, using these capabilities, approach in Arts Equal, we asked a central question: what can people actually do and be in terms of participating in the arts? This approach goes beyond simply having opportunities to engage in the arts. It emphasizes the real capabilities people need to participate in arts and culture in a meaningful way. At its core, the capabilities approach centers on freedom and choice as essential to both personal and societal well-being. Applied to cultural engagement, this perspective highlights the importance of not only having the freedom to participate in the arts, but also having the necessary resources and social support to make this participation possible and enriching. One critical factor here is cultural rights, which protect the access to artistic activities, support personal development through the arts, and ensure freedom of creative expression. These rights are safeguarded under international human rights agreements. And in Finland, the Constitution further guarantees these rights, supporting human dignity, equality, and access to arts and arts education as basic rights for all. Despite these guarantees, significant barriers remain. There is a gap between these rights in theory and reality. While legal protections exist, many people, such as those in care settings and older adults living independently, face barriers to cultural engagement due to systemic inequalities. Furthermore, as sociologist Robert Putnam has shown, disparities often begin before school age, as children from less advantaged backgrounds have fewer opportunities to develop their resources, skills, and cultural awareness needed to fully engage in the arts. In other words, these children lack certain competencies. This lack of competencies reflects a broader limitation in capabilities, essential freedoms needed to participate in the arts. Sense concept of functionings refers to the actual activities and experiences people achieve. In arts participation, functionings represent what a person gains from engaging with the arts, whether appreciating a performance, creating art, or developing artistic skills through arts education. These functionings are the tangible outcomes of engagement, reflecting how someone actively participates and expresses themselves through the arts. On the other hand, capabilities are the freedoms and resources people need to achieve these outcomes. This includes access to arts education, time and supportive environments that encourage meaningful engagement in the arts, concepts that align with Pierre Bourdieu's ideas of social and cultural capital. In essence, while functionings show the realized participation in the arts, capabilities represent the potential to participate, shaped by resources and personal development. Both are essential to understanding how people can live fulfilling lives through the arts, or conversely, how they may be excluded from it. Importantly, basic capabilities such as cultural knowledge and social resources are what enable active participation in arts and culture. Consequently, the lived, embodied experiences of participating in the arts not only strengthen one's capability to engage with art on a deeper level, but also contribute to personal development, well-being, and common good. With adequate opportunities and capabilities, what matters is agency, defined by Amartya Sen as someone who acts and brings about change. At the end of the day, what matters is that we put our capabilities in use and take a step to engage with the arts. Taking these steps ensures that cultural well-being becomes a tangible reality in various contexts, including healthcare. For me, this constitutes the framework to address the materialization of cultural well-being in any context, including hospitals and other healthcare settings. It not only informs our understanding, but can also guide actionable strategies, such as enhancing arts education and integrating arts professionals into care settings. Now, art does not inherently or automatically enhance well-being. For art to be impactful, individuals need a personal relationship with art and the capability to engage with it. The engagement is influenced by the embeddedness of cultural capital, supported by institutional factors like quality arts education and accessible art opportunities. However, resources for developing this relationship are unevenly distributed. In Finland, for instance, participation in the arts is disproportionately common among upper middle class, native-born residents from families already engaged in arts and culture. This inequality often begins even before school age. Research by Tuulikki Laes and Pauli Rautiainen highlights that early exposure to the arts is a strong predictor of continued arts engagement into retirement. Still, even those without early exposure have the potential to build meaningful relationships with the arts at any stage of life. Developing this relationship contributes to a deeper appreciation and understanding of art and enhances artistic skills. In turn, these capabilities support a more meaningful and profound dialogue with art. The Arts Equal initiative underscores the importance of high-quality arts education for creating meaningful arts experiences. In some health and social care settings, specialized arts professionals such as hospital clowns, hospital musicians, dance ambassadors, or art therapists facilitate arts engagement, and that's great. Additionally, caregivers and family members with a personal connection to the arts can play a valuable role in patient engagement, though this potential is often underutilized. Ultimately, fostering cultural well-being in care settings requires recognizing everyone as an active, reflective participants with unique backgrounds and interests. By sharing and reflecting on arts experiences, we can nurture personal connections to art that contribute to cultural well-being in terms of individually perceived well-being and through human development to common good. Now, let's next look at some practical suggestions how we could bring art into hospitals and other healthcare settings. These suggestions are from Arts Equals Policy Brief 1 2020, Culture and Art in Hospitals and Other Healthcare Settings. So, what can we do besides invest in public art initiatives to enhance cultural well-being in hospitals? You can help empower patient agency through arts and culture. For example, you can engage patients in selecting radio programs or music they find interesting, then discuss their thoughts and feelings about the content. You can use creative writing techniques to help patients reflect on their personal circumstances, offering them a way to articulate and process their experiences. Another practical way is to promote health and well-being through arts communication. You can, for example, create memorable rhymes or raps about hand hygiene to make health practices engaging and easier to remember. This rhyme was generated by artificial intelligence. It took no more than 10 seconds to emerge. It's usable. Or you can use immersive short films to share peer experience in a more nuanced and impactful way than traditional discussions. Nate Milton's animated short film Eli is a powerful exploration of a manic episode told through the lens of a 15-year-old named Elijah, who believes an alien raccoon has implanted a share of meteorite in his ear, driving him to a grand delusional mission. This 11-minute film, which is available online in YouTube, is based on Milton's personal experiences with bipolar disorder. And it utilizes animation to vividly portray the complex emotions and cognitive distortions that accompany manic delusions. By using surreal imagery, Eli offers a unique and empathetic perspective on mental health, making it a valuable resource for arts in health and well-being. Its ability to visualize intangible mental states can foster understanding and empathy, opening conversations around mental illness in a creative and impactful way. Another practical way is to promote health and well-being through collaboration with, there is a wrong title obviously, collaboration with local schools of art, dance, music and theatre to establish long-term partnerships, including performances, open rehearsals, exhibitions, workshops, or socially engaged arts projects in healthcare facilities. The earlier mentioned dance ambassadors, for example, do this on a frequent basis in southwest Finland, visiting both care settings, private homes of elderly people, engaging people into dance improvisation through everyday dialogue. And you can integrate a holistic, person-centered view on care. This is another concrete measure. You can explore a patient's cultural background and personal journey using tools like the Tree of Life methodology to understand their life story and the needs better. In the Pirkanmaa region in Finland, the Tree of Life approach focuses on improving the cultural well-being of both working age individuals and seniors. This approach encourages individuals to create a personalized tree of life where they record their cultural preferences, needs, and desires. The initiative connects people with cultural well-being services through client guidance, ensuring they can access arts and cultural activities that align with their interests. For working age individuals, this tree of life is integrated into cultural prescription, much like social prescribing in the UK, to facilitate access to cultural offerings. You can also strengthen the role of art therapies. You can form multidisciplinary teams, including art therapists, community artists, and healthcare professionals in settings like hospitals. Physicians can then evaluate how art therapy can complement or even replace other treatments for individual patients. But to do this, you need to educate doctors on the benefits of various art therapies and how to incorporate them into patient care plans. A great way to introduce art in hospitals is to institutionalize artists in healthcare settings through artist in residence programs. You can allocate a discretionary portion of the healthcare organization's budget for art and cultural activities to support cultural well-being alongside medical care. I really like this idea of murals being considered as hospital instruments. Equipment. Thank you for bringing that up. That's a genuinely valuable argument that can be used in many discussions. Very, very good point. So incorporating arts and cultural programs such as the visits of hospital musicians, hospital clowns, or dance ambassadors into daily and weekly schedules, ensuring consistent access for patients. And while doing that, do not let the patients decide whether they want to engage or not. Do not decide for themselves. Even bedridden patients can and will dance if they so wish. I realized in my own research that healthcare personnel restricted access to bedridden patients, restricted the access of dance ambassadors to bedridden patients because they thought that people in bed can't dance because dancing needs feet. No, you don't. You've just been dancing with your nose, and you know that dancing doesn't need feet. Not necessarily. So anybody can dance, and therefore there is no reason to decide on behalf of patients what they can do or what they cannot do. Yes, arts for workplace well-being and professional development. You can form workplace choirs to provide a creative outlet, reduce stress, and foster team cohesion. Using applied drama, for example, forum theatre, you can use it as an approach for experimental learning that can help staff critically evaluate workplace and patient care experiences in a collaborative setting. These examples illustrate how arts and culture can be seamlessly integrated into healthcare to promote well-being, agency, and inclusivity for both patients and staff, and this also can respond at least partially to these questions of how to handle burnout or sort of prevent burnouts of staff members by creating these opportunities for discussion at least. Partially this might help. To conclude, I wish to return to earlier discussed personal relation to art. I want to emphasize the invaluable role that healthcare providers can play by drawing from their personal connections with art and culture. Doctors, nurses, and care staff who bring their own experiences with art into their daily interactions with patients enrich those moments and lay the groundwork for cultural well-being across healthcare settings. This personal engagement is a powerful, yet often overlooked resource. By nurturing these personal connections to the arts and advocating for structural changes that integrate specialized artists into healthcare settings, medical professionals can champion a more holistic approach to patient care. This commitment not only supports individual well-being, but also fosters a positive, resilient healthcare environment, enhancing the occupational well-being, work culture, and overall atmosphere of health institutions. Together, we can make arts and culture central to fostering cultural well-being in compassionate and comprehensive healthcare environments. For more information, you can turn to Arts Equals website. There we have our policy recommendations and the final report and the list of publications. The project altogether generated, I would say, more than 250 scholarly publications during the 6-year period. So it's all on the website, and most of it is also in English, so that helps for disseminating the results. Thank you so much. There are my contacts. Do not hesitate to get in touch if you have any questions. Thank you.
Thank you so much, Kai. What an informative presentation and very many insights. And now we have some time for questions. And yes, there's the first, please.
Hello, Kai, and thank you, Marcel, also. Beautiful presentations today. And Kai, this was best presentation you had for me, because I am sociology, and it's my major, and there was so many sociologists you mentioned, so thank you. But one comment, I think we have discussed very much about arts in hospitals, and one thing is the professionals who are social and healthcare professionals, as you, Kai, mentioned, and I am Mira Hate from Metropolia University of Applied Sciences, and we have in Finland quite many upper master degrees for cultural well-being, and in Metropolia we have only this in English. And one thing, we have now new curricula. Is it the right word? Yeah. Curricula, and the cultural well-being is integrated into so many social and healthcare degrees. So it's very important that those social and healthcare professionals also study and can use creativity at their work. Thank you.
Thank you for your comment. Absolutely, I fully agree. This is a trans-professional field, interdisciplinary field, and we need increasingly collaboration, and it is important to educate social and healthcare sector. I think what you're doing in collaboration with Metropolitan University of Applied Sciences and Jyväskylä University, that's remarkable. That's a remarkable initiative in this area. Also, in the Finnish-Swedish region, Åbo Akademi has taken a great step towards integrating cultural well-being into person-centered care. We just completed a project where we trained all the responsible teachers in elder care in all the Finnish-Swedish universities of applied sciences. We trained them in cultural well-being and person-centered care, and as part of their training, they integrated these ideas into their particular curricula. So eventually, when their students graduate, they will be the change agents in the field. So this, I think, is a very important sort of a way to genuinely materialize the impact in society, in the health and social care sector.
Well, I myself, I would actually like to hear still your reflections on one topic, because I come from the arts and culture context, and I've been trained like in the with the idea that like freedom for arts is the central value, and so how do you see that like artistic freedom, so that like art is there for art, like the inherent value, and that like the art can tackle with questions that like is interesting for art, totally outside of the kind of health or care context. So how do you see that this question is like, how do you tackle it in your work?
That's a very good question, and it would take us at least a bottle of wine and the whole evening to discuss this deep philosophical problem. To put it briefly, yes, arts for art's sake, arts as an autonomous field has significance in society, like basic research has significance in society. Nobody questions the meaningfulness of basic research. Nobody should question the sort of significance of artistic endeavors for the sake of art. In the arts field, artists tend to focus on themes that, on one hand, they find interesting for themselves to investigate through art. On the other hand, they integrate into their thoughts cultural narratives on what art is, historical narratives on what art is and what is considered meaningful and important. This whole thing boils down to, on one hand, in Western thinking, into sort of enlightenment and the formation of subjects as independent entities, as well as the formation of professions as independent entities. And this development has ensured that in the past several hundreds of years, we've been able to develop these fields tremendously. While that has happened, in Western thinking, we have either-or logic. That helps us understand things, and we conceptualize ideas into boxes. It's either this or it's either that. We apply binary logic in doing that. And Jacques Derrida has challenged this idea and said we should sometimes use both and logic as well, rather than either or. But this either or logic makes us distinguish things into boxes. And when this distinguishing has done, in the age of modernity, another thing that has emerged is this enormous need to protect boundaries. Whether it is the boundaries of disciplines, whether it's the boundaries of professions, or whether it's the boundaries of nation states, whether it's the protection of sort of socially perceived races, even. I mean, in our history, we have that past. So in modernity, there is this sort of a tremendous need to protect the boundaries. And while there's been this need, there's been also this sort of a sanitation project, this desire to keep these boxes clean from contamination from other fields. So there is this compulsory neurosis, I suppose that's called, that's a psychological term, pakkoneurosis. Is that the English term, compulsory neurosis? Where you sort of you are sort of compulsively cleaning places to ensure that it's clean. We have this compulsory neurosis in the age of modernity to keep these boxes clean, and this is the history of why keeping arts for art's sake, keeping healthcare for healthcare's sake, keeping engineering for engineering's sake. This is part of this is my interpretation of our history. But when we entered the 21st century, when we entered the 20th century, we realized that there are complex challenges in society that not a single discipline or not a single professional field can handle. So we generally need interdisciplinary collaboration across sectors, and this is where we are. And so we still have this tradition of protecting the boundaries, keeping art for art's sake. And certainly, yeah, there is a need for that development, but alongside, there is need for collaboration for society's sake. And not just for society's sake, for this planet's sake, for heaven's sake, you know, considering what's happening with climate crisis.
There we have a question.
Yes, thank you. My name is Pekka Lahdinen. I come from medical background. I'm a medical doctor and pediatrician. I used to work in Children's Hospital, New Children's Hospital, and actually I was head of functional planning during the design and planning and construction period. So most of you, when you visit that hospital tomorrow, you will see some of the results. I'm pretty much guilty of everything. Well, the reason I wanted to comment on your nice presentation is a little bit along these lines. You just mentioned recently about these separate boxes. In one of your slides, you mentioned that one way to facilitate art integration into hospital is to train physicians about arts. I definitely agree. Easy to say, but it is very challenging. I can tell from my own experience. Well, most of you certainly understand that physicians and healthcare professionals are not unaware of arts and the meaning of that. But the thing is that healthcare professionals and especially medical doctors are trained pretty much in biomedically to show evidence in anything really is stringent, and doctors are trained to criticize everything. They don't believe in anything if they haven't gotten proof, and that's how this training of physicians about arts and healthcare professional is important. And now I refer also to what Marcel told before, that the approach, how to show the evidence, is very important whenever doing collaboration and cooperative developing processes in healthcare, in new buildings or in any project. So this is something to keep in mind when outsiders from art world come to hospitals and try to tell the physicians how things are. That's not a good way to approach.
No.
You see what I'm getting at. So how you feel about this?
I absolutely agree with you. I didn't mean to say that physicians are unaware of the arts. I know personally quite a few physicians who are incredibly good in the arts. Some certainly their understanding of music is much higher than my understanding of music, despite my sort of a background in dance, which integrates music in a great deal. So certainly I don't mean to say, but this idea of understanding how arts could be integrated into health and well-being in a broad sense, in a holistic sense, training there might benefit. Similarly, and I would say even more impactful would be to strengthen the arts education of our school teachers, so that we would have the personal experience of the personal relationship with the arts for every young child from school age on. Currently, the training of school teachers includes very, very little of the arts, and it goes very thin. So to start from school teachers first, then we can move to other sectors. But then I fully agree with you on evidence-based thinking. I think that's important. But at the same time, we need to ask what counts as evidence, and whether we should apply the medical understanding of evidence to the phenomena in society in general, or whether we should keep that just in the medical context, as medicine as a field is culturally, socially constructed field as any other field. But thank you, a very good point you made.
There we had a question, Ricardo, please.
Yes, thanks so much for these two inspiring talks. In fact, I would like to extend also this reflection to, so Ricardo Atienza, Aalto University. And I was particularly interested also in the role of the artist in these questions we are exploring here, because I'm not sure that the education we are providing to our students is also equally suited or open. I mean, we have been talking about code or participatory practices, co-creation, and I think there is also, we have quite a lot to do also in how or which kind of education we provide to our students to be able to engage in this kind of practices. So it's quite unclear to me that they have the tools for really approaching it. They are still like this idea of the independent artist. I think it's still very, very present. So I don't know if you have analyzed a bit this role of the artist, or what the artist should be, or what his... Thanks so much.
Thank you for that question. Very important question as well. Working within socially engaged arts practices, this is sort of my overall concept for any kind of artistic work outside the arts field, sort of the traditional arts field. So working in socially engaged arts contexts requires special skills and competencies besides artistic, sort of core artistic skills and competencies. Those need to be trained. And I've written quite extensively on that. I'm currently actually writing a book for Routledge on socially engaged arts and its role in higher arts education as an independent subject of study, and also its importance for the third task of universities, engagement with society. And there are increasingly sort of educational programs, particularly in continuing education field, emerging. I know that the program in Metropolitan University of Applied Sciences, Metropolitan University of Applied Sciences, that's you have both. It's both for artists and social and healthcare students, right? The master's program.
Yes, we have. It's a very transdisciplinary
approach.
Exactly. So we have half and half. The group from cultural fields and from health and social health fields.
That's right. And there is an open access course. It's only 5 credits, but it's available online through Uni Arts Helsinki and our partners in Austria. My colleague Eva Siljamäki and I created it a couple of years ago, and it's still there online. But this question of establishing a master's program for artists working in socially engaged arts in a broad sense, this is a matter that sort of I hope to take up at Uni Arts Helsinki in the next few years. Unfortunately, our current economic situation is not in this country very good, so it's very difficult to argue for new programs to establish them, but it remains to be seen, at least in continuing education. But much needed.
Thank you. There we have one question.
Yes, thank you, Kai. I don't have a question, but just contributing to the discussion. So I'm Taru Koivisto from UniArts Helsinki, and I'm now working in performing the political project, and we have some preliminary findings of this issue that we are talking now. So, and we have some Nordic identifications also that our higher arts education systems are pretty much built to support the identity formation of the students. And that supports that notion that art for art's sake is important. But what we have to do now, and what we have with Taru Tähti also suggested, that we should also embed, as in medical schools too and nursing schools, embed this content into the programs, because people are so overwhelmed nowadays, and students are also overwhelmed with their studies. So that's also one thing that we can do to contribute to this issue. And I had something else, but I already forgot. Yes, it's just about the notion that now as teachers, we also have to help and as stakeholders help students to open up to the society, because not all kinds of art genres, but for example in music it has been very strong emphasis on the neutrality of music, and for example that musicians should be political somehow, not political persons or contributing to the society. So there is very strong discourse change and change that we have to do in these institutions that are very strong and conservative also in nature, which is good also. Just this kind of contribution to the discussion. Thank you.
Thank you, Taru. Very, very good points that you made. Nothing is apolitical. Even remaining apolitical is a political decision. Nothing is apolitical. Good point that you made.
Well, thank you all for your insights and for your contributions to the conversation. And thank you, Kai, for your insightful presentation.
A pleasure.
Thank you so much.
Thank you so much.
Thanks. Dear friends, welcome back from lunch. And now we will start the second part of today's program with insights from artists and curators on the hospital art environment. And now I'm happy to welcome Laura Itkonen, artist, mainly working with ceramics. And Laura is interested in creating visually intricate and tangible architectural art and collectible sculptural design objects. And her most recent work includes the making of ceramic relief ensembles for the Women's Clinic and the A-Wing procedure rooms of the HUS Helsinki University Hospital. Welcome, Laura.
Good afternoon, everybody. My name is Laura Itkonen, and I'm a ceramic artist living and working here in Helsinki. I've been doing ceramics since 2001 when I first started my craftsmanship studies with it, and I completed my master's degree in 2010 at Aalto University. I'm working as a professional artist in my studio in North Helsinki, and in my practice I've been... Can you see my... Here is the first slide. In my practice, I've been working in between art and design, but in recent years, my work has focused more and more on the art side. I have made commissioned works in Finland and abroad for public places like hotels, senior living centers, and hospitals. Currently, I'm working on another relief work for Hus-Hyvinkää Hospital. I'm quite material-based creator and artist, so my art is often based on clay and its chemistry, which is endlessly fascinating for me, and the material plays quite a big role in my creations. I'm very honored to be here today and to talk to you about the process of making art in hospitals from the artist point of view. I will be talking about the process of my latest public art project, which was made for HUS Helsinki University Hospital through the women's clinic there. I will go through some aspects of the project that I feel have a special importance when creating public works, especially for the hospital environment. I was invited to make art for elevator lobbies in all 6 floors and 5 procedure rooms of the women's clinic. Project took its first step on spring 21, and it was finished now in August 2024. Throughout the project, we worked together with a multidisciplinary working group, which included the project's architect, and from HUS, an art coordinator, an architect, and an administrative head nurse. In the beginning, before the actual draft phase began, we went through some limitation when it comes to art in hospitals and the environment, and some wishes from the working group as well. In the hospital environment, there are, of course, mandatory things to consider in relation to the artwork. At this point, the communication with the multidisciplinary team was particularly important for me because the various issues are taken into account as early as possible. The things that came out in our meetings were that the pieces need to be cleanable but interesting. Materials have to be durable. The renovation and interior choices in this particular project would emphasize the style era of the actual building. Possibility to have a difference between the artworks on different wards on different floors. Possible light elements in the artworks, that was the architect's wish, that if I could possibly do that in those works. And when talking about ceramics, 3-dimensionality, we talk about it a bit, and a point arose that the work cannot have parts that protrude too much from the wall surface so that the clients could hang on them or climb on the walls or anything that I couldn't even imagine myself. My own design background can be seen in my own process, especially in projects where the artwork is made for a certain space. My ideation was based a lot on the viewer and the location. I sought deeper content for the works and the visual answers to questions like, where is the work located, and what kind of environment the hospital is, and how people experience the hospital in general. Who is looking at it, who is the viewer, and what has brought them there? In what kind of emotional states is the work viewed? And also what I want or wish to convey with my works. As I naturally like to play with contrast, I sought inspiration from both architecture and the human body, and these were the starting points for the visual looks of the works. Since the building is protected by the Finnish Heritage Agency, and it is an example of the style of its time, the main theme of the whole renovation was to keep and bring out the era of functionalism in the building. Considering the significance of the building, I found it to be an important source of inspiration for me too, and also quite natural because I often like to observe our environment in the cities. Alvar Aalto's creation, Buy Me a Sanatorium, was one source of inspiration for the architect's office. So that was also a base for me to colors and forms. Also, the several textures of the women's clinic building inspired me to play with them in actual art pieces. Combined with these man-made structures, I wanted to bring softness and warmth with organic shapes and surfaces that I drew inspiration from human body, and in this case, especially female body. I searched soft textures and warm colors and glazed surfaces to a naturally hard material like ceramics. What are the elements that make the material look a bit softer? In general, the characteristics of the material, the tactile, abstract form language, and playing with contrast have been natural for my expression. In my work, sometimes forms combined together create suggestive characters. This has come up in conversation with the viewers of my works. Many have seen human forms, buildings, and animals, and especially birds in them. Our senses tend to form familiar features from things we see and that we perhaps quite don't understand what they are. This was something I wanted to bring out more strongly in my works, especially after talking to people about their experiences of hospitals in general. Many said that even though modern hospitals are more friendly with their interior and color choices, it's still a place where you feel like you want to get home as soon as possible. And I guess it's quite natural experience. I wanted the viewer in the hospital to find something familiar in my works, something that makes the eye wander through it and find new things here and there. Something that leads the viewer into some other world, whether imaginative or real. Creating these imaginary stories to the hospital became as the starting point for my works. The idea felt right when I thought about the ceiling works in the procedure rooms, which are placed above the patient's bed so that the patient can look at the work during the procedure. I also felt it was important in a project like this that the work were as universal as possible, so that people from all backgrounds and cultures could find something familiar in them. My material choices were quite obvious. Ceramics was my number one material. It's a well-suited material for public works because it's durable and cleanable, especially when glazed. In these works, I used different clay types depending on the used technique and required outcome. All parts were handmade. Light as an element for an art piece was a new thing for me, but something I wanted to take up as a challenge to this project. Making them out of ceramics doesn't make sense in this kind of environment, because if you want a porcelain to be translucent, it has to be very thin in thickness and thus more fragile. Therefore, I accepted the challenge and looked for another material for light elements, which would visually match with the ceramic parts and the vivid glazes. And thus I wanted to choose a material that I could experiment and work with my own workspace and influence its visual end result. Of course, the material should be also translucent and durable. For these reasons, bio-resin was selected as my material for the light parts. After several tests and experiments, I found ways to achieve the same liveliness to the looks as some in the glazes. These effects can be seen in larger pieces like that blue one there in the middle. These on the right are from the works, and on the left two are the works already installed, and then there are some glazed parts in the middle of the process. When creative work is strongly based on the material, every work step is important in terms of the end result. So for me, it's quite important to be involved in every step as an artist and maker. Insights and coincidences that occur while working often lead to solutions to problems. In the draft phase, I produced texture samples, color samples, and material samples, and found the methods and results I liked best for the end result. I wanted different details for the work so that there would be as much to look as possible. Here are now some pictures of the ready-made works. Through all these elements and colors, I made slight visual division between different wards on different floors. The ensembles of the polyclinic floors, which are first and fourth floor, are inspired by architecture, and the emphasis is more on the bright colors of Paimio Sanatorium and the shapes and textures of the building. The relief in the maternity ward in the second floor is inspired more to the human body and soft coloring and forming a whole with warm visual look and bodily textures. The ensembles of the inpatient wards in the third, fifth, and sixth floors combine shapes inspired by architecture and the human body and the communication between those. There are a lot of contrast, especially emphasized. And then about the ceiling works, the ceiling reliefs are captures from the larger reliefs from the elevator lobbies. They are small detailed moments within them. They are placed over the procedure beds for the patient to view. And of course, in such a large project, which took so long time also, not everything always goes according to the plan. The first and luckily the only bigger problem in the project came out in the beginning of the installation. Due to mistakes that occurred on the construction site due to communication errors, we had to change the light plans on a fast schedule. The LED lighting we had chosen with the architect in the beginning couldn't be installed without a major repair work, so we have to change the light to the fiber lights. After talking with the workers during my installation days, I realized that they had a little idea of what kind of entity we were all making together. In retrospect, I have thought that maybe it would have been useful that the site manager would have been at least one of the meetings with our working group, so that the site would have had more and like a better understanding of what is coming to where and how. Overall, everything was completed on time and in the end with very few problems. It was less stressful for me to solve more familiar problems in my own studio with technical issues, but it was also instructive when you can't all the time concretely promote progress in your own project. Thank you for listening and inviting me here to speak. This was now a project of a few years in a small nutshell, but please, if you have any questions now, you can ask here or then later on by email. Thank you.
Thank you so much, Laura. What a fascinating and elegant visual world. Now we have time for a couple of questions. Well, yes, please.
Well, I'm Mikko Snervo from architect group Reino Koivu. I'm from the company that worked on your project.
Yes.
You probably worked together with my colleague and our boss, Markus.
Yes, he was the one.
Koivula.
Yeah.
And we visited the site a month ago or so, and it was truly wonderful. I was really happy to see those works. Some of them were completely finished and some still going through the installation process.
Yeah,
But
thank you.
we all enjoyed them a lot, so thank you.
Thank you.
And one important thing that you brought up is how we should really take the construction people into the process as well.
Yeah.
When I was working on the Lighthouse Hospital, Majakkasairaala in Turku, there we had sort of the whole team of engineers, architects, the staff, everyone involved in the arts projects, in the art world that we were trying to create together. We had the art coordinator and us architects and the artists, they were all informed about what we were trying to do.
Yeah.
But to actually also show the drawings to the people who install them is equally important, I feel. And this is like a really important part that you brought up. So I want to thank you for that.
Yeah, I find it quite important because that was the only bigger problem there, and I think it was the communication, that people weren't aware of what everybody else were doing, and well, when I worked there, I talked a lot with the workers there, and they were just like, I guess it's always, no matter if you're renovating a kitchen or a big hospital, but they were all saying like, oh, if I would have known that this was coming there, I wouldn't put that plastic box in there. So kind of like this, I don't know, I just started to think that, is it always like this? No matter what size of renovation it is.
It's always like
yeah, and I don't know if the communication can help, but
always
yeah, somebody just
go
puts
to
some.
the person who's doing the work.
So probably like you cannot change everything, but just a tiny bit would be a big help also.
Yes, please, Finbar, and remember to use the microphone. Yes.
Hi, Finbar Rosato. I'm from Region Stockholm. I had a question about the way that this project might fit in with, with your artistic practice generally. Was there? You said that it was a long kind of process to work on this. Was there anything specific from the project that has had like a big impact on on your artistic practice afterwards? Did it change things? Was there things that you learned there that kind of pushed things forward for you out beyond the project?
Well, definitely yes. I think my own like a personal artistry made a huge growth, and kind of like also gained a lot of kind of self-confidence, and now because I want to do more art, I kind of like feel like my road is leading naturally to that direction. But yeah, definitely it was a very learning experience because it was such a big project. I hadn't made this like 6 floors to the same place, and so yeah, I doubted myself a lot. But then again, after the project, I kind of like can stand on my feet again, and it was like a really, really significant project for me as personally. So yes, definitely, it made a change to how I see myself as an artist and what I want to do in the future also. And basically that I can handle this kind of project too. That was good to know.
Yes, please, Mauri.
We discussed earlier in the morning about autonomy of the art. How much your hands were tied during this process, making this your works?
In this project? Well, my hands were quite tied to this project for I would say that from fall 23 to August 24, I didn't schedule anything else to it because I always, kind of like when you know your own working too, you kind of like, I wanted to have myself free time as much as possible to make it, and when making ceramics it's also quite slow. You always have to wait, and then you have to use kiln, and like there's a lot of time when you just do waiting. So So yeah, it was a.
Maybe like on what aspects could you yourself like have impact and choose? Kind of where did you feel that like your artistic freedom was, or did you feel that you needed to make compromises, or how did you kind of assess your artistic freedom? Maybe.
Oh yeah. Well, yeah. Of course, you kind of like in a technical things, especially, you have to make compromises. But I don't like in the content of the works, perhaps not so much, because I don't know, maybe it's my design background. I'm not like so totally artistic in my process, so that it was so natural for me to kind of like start from the viewer and the place. So I didn't feel like in the content I had to make any special compromises, but with the material and end results, like techniques and surfaces, and especially on those organic forms, I searched quite a long time, like how would I like the end result to be, and it was the one in my own studio, the one like a problem that took a bit time for me to solve out. So in that case, I did make some compromises with clay also, because my first thoughts was visually I didn't like them. So yeah, there was also like difficult times in my studio and in the making process, but more of I feel like I had to make compromises with techniques and with the material.
Thank you, Laura,
Thank you.
for this presentation.
Thank you.
Yeah, applause. And now I'm happy to welcome Taru Elfving, who introduces us to the perspective of a curator on art in hospital. Taru Elfving is a curator focused on nurturing undisciplinary and site-sensitive inquiries at the intersections of art and ecology. As director of Contemporary Art Archipelago, she leads an artistic research residency collaboration with the Archipelago Research Institute at the Turku University on the island of Seili in Archipelago Sea. She curated the series of site-specific art commissions for the Bridge Hospital in the Helsinki University Hospital, HUS in Meilahti. And Taru will also guide us tomorrow at the Bridge Hospital. Welcome, Taru.
Thank you. And first of all, huge thanks to Laura. It was great that I follow the artist's presentation, because I think Laura also gave us a really good insight into the process of what happens in these commissions, for each artist. My voice is going a bit. I've had a cold a while ago, but so hopefully it gets through. I also hope that I'm going to keep in time, because of working for with this project for over 5 years. I'll try to condense that into 15 minutes. But I hope that you're just going to give me a shout, if I'm not keeping up. And now I'll see if I can use this. Now which way do I go? Yes, worked. Okay. Just a little bit of background first, and I want to walk you through the different artworks that have been commissioned and realized now. And then with each project, I'll tell you a little bit about the sort of specificities of this. But as Aino said, I've been working specifically as a curator and researcher with kind of site-specific projects, usually quite research-based artistic projects. And this is also something that I worked in a number of different kinds of context outside of the art sort of context or art spaces, but this was the first time I was working in a hospital context, and it was a very specific kind of public space for me to work with. and also with the artists, most of them had not worked in a hospital context before. And so it's very, very specific. So, but coming from a curatorial approach to site specificity, this is, for me, was really important to start with research and start with really trying to understand where we are, where I am. And this is also the process that each artist was kind of able to really do quite extensive amount of research into the context and the building, the different processes, the different uses of the different parts of the building, and what actually goes on there. And as a background, so when I was invited or selected to curate these commissions in 2018, I was given with a theme, and so I was asked that is this really is this a really bad starting point for these commissions, that we've kind of got a theme for the building already, that we'd want this theme to be also something that cuts through the art commissions? And I felt my first thought was, okay, so we've got a very kind of strictly already kind of controlled framework of where we're sort of producing new artworks, but then we also have a theme already that has to run through the commissions. But I think in the end, I actually felt that with the artist and for myself, these things together made sense. And the theme was, there was a real desire to somehow create an identity for the building as a hospital that was in Helsinki. So the theme from the beginning as also something that the architects had been considering when they were designing this new building that was actually a kind of a connecting building between existing hospital buildings in this Meilahti hospital complex. And they really wanted this to kind of somehow be a kind of a sort of series of artworks that could not be in any hospital, but were specifically made for this hospital, for this specific urban context of Helsinki. One thing behind this was also that an old, very important, historically very important hospital building in Helsinki was being closed, or closed from hospital use, Töölö Hospital. And I think this was something that kind of came with a sense of legacy that they really wanted to bring to this new building somehow. And so the kind of focus on the environment and what the theme in Finnish, kind of in a bit poor translation to English, it would be something like a lively or living environment of the Helsinki city. And this was the kind of loose thematic that we started with. And the kind of these questions around artistic autonomy and kind of working with the specific places and contexts like this. I think that kind of we're obviously very aware of the different kinds of that we were in the service of particular needs as well as making art for this hospital building. And this is something that I definitely shared with all the artists, that there was a sense of real significance, a sense of kind of a intrinsic value in actually being able to produce work for kind of a public space like this, that also kind of knowing that the work will be actually seen and will have an impact of some kind to a huge amount of people from very different demographics of our society. So a very unique kind of environment in that sense. You have a kind of for better and for worse, a kind of a captive audience, often for your work in a way that, again, is different to, for example, an outdoor public space, where maybe a lot of people kind of engage with the work, but don't have that kind of, that sort of intimacy with the work. And the other thing that was really fantastic in this project, really, was the openness from the side of the hospital and from the architects on actually really wanting to commission new artworks that would be integrated into the building and in its kind of different functions, but without pre-describing where the artworks would be, should go. So there was a kind of an openness, that invitation for the artists to come and explore and to think of kind of where and what they would like to make and offer, and then kind of develop a proposal. And so kind of from the beginning I was told that it could be anything. The artwork could be a performance. we didn't end up actually commissioning a performance. I still have some really good ideas. I think that maybe one day, but kind of a real openness in terms of what could be a kind of also a question of how can we understand this sort of permanence of the kind of and the kind of materiality maybe of the kind of art commissions in the building. That what does it mean for an artwork to be integrated into the building? That could a performance be that? And I think there's something that was kind of really opened up a lot of possibilities. And so for the first, we kind of started quite early. The building was nowhere near there yet. They were doing foundations, I think. The design was still being kind of, fine-tuned. But it was still kind of already a little bit late. You know how this goes, the process is quite slow, and then suddenly the building just goes up like woof, like overnight there's suddenly a whole massive building. And the architects were trying to keep up, and we were trying to keep up. But we first started from one artwork that had to be designed, first of all, kind of quite quick because of the building schedule, but then the others where there was more kind of time. So we actually started with the print. That you can just about see. I don't have any close-ups here, but hopefully at least some of you are coming tomorrow for the tour so you can see it up close and personal. So the prints that were already in architectural plan, that the class had prints on it that would kind of somehow soften that black and white grid-like structure visually of the building. And so this was the kind of very, very rigid, in a way, framework for an artist to work with, of what could you do with this. And so but this came in the end for the artist who was selected to do this, Sari Palosaari. So this also came with a kind of, we set up a kind of a process. I can talk more about that if somebody's interested in how the artists were selected. But for this, for example, we had 3 artists who proposed, who made sort of concepts, and then Sari's concept was selected. And there was also an idea that then the same artist would actually make work for the inside of the hospital. And so this the print, in the end, the kind of image the idea came from reflections on the sea. So the idea of the kind of Helsinki as a city that is totally surrounded by the sea, the presence of the sea. And so now the building actually kind of glitters like the kind of sun glittering on the surface of the sea when the lights change. And Sari's work for the inside the building, actually in the kind of bridge that gave the name to the Bridge Hospital, it was a work that was then inspired by some of these visits, for example, to Töölö Hospital, and the kind of thinking about the city in a way as a sort of. She started exploring, as a sculptor, she started exploring the materials of Helsinki city and really got drawn to those sort of buildings and the sort of public infrastructure of the city centre that was built post-Second World War, at the time when the kind of, in a way, the city culture was really being built in Helsinki. And so brass became a material that she actually picked up from the kind of centre of the city and from a lot of that time architecture that really marks kind of the kind of architecture of the city. And she ended up working with brass, but actually then making reference with brass to contemporary, in a way, movements in the city, of how people move through the city and what kind of marks they leave for each other, and how they kind of, these sort of circulations and constant sort of flow is actually marked by different kinds of objects and these sort of little signs. So we have these coffee cup columns that I've noticed on the stairs that a lot of people seem to, like when there's, for example, nurses having a break, they seem to there's always somebody sitting next to them. So they've become a place where somehow you get kind of drawn to, that there's somebody there already, the artwork, so you sit next to them when you have your coffee break. And then there's these on the glass rail. They kind of reference the newspapers that are left for the next person to pick up, which actually doesn't happen anymore after COVID. So these references already, it's crazy how fast as urban culture changes. And then we have these sort of railings in a way, and also these little coins that have been kind of inserted into the steps. Another bigger work that was then commissioned quite early on is Kalle Ham's Rosarium, that started as a proposal for a lot smaller work and in a different space, and became this really kind of like an icon through these dialogues with the with the architects and with the hospital, with the Kalle's proposal, and then actually turned into this really huge sort of piece in the end, in this sort of central kind of part of the building. And the sort of starting point for this was that Kalle discovered this rosarium that is right next to the hospital, and it has there's a rose garden that actually has a number of different roses that have been found in Helsinki. So they're only found in Helsinki. They are kind of these sort of varieties that are specific to different parts of the city, and so he created this work that actually then took a number of these different roses that are specific to Helsinki, and usually they're called by the place where they've been found, and sometimes by the name of the person who's found them. So this, for example, is the Helena of Herttoniemi, is this rose, and so it became kind of an iconic image. That also there was a lot of this dialogue between the hospital and the kind of commissioning jury and the artists, but also different groups of the kind of users in a way, staff, also patients in this process of actually working with these proposals from the artists. And what came up time and again was that we can't bring living plants into the hospital anymore. And so there was a lot of we kind of want the plants in the building, but we can't bring them. So this was kind of one thing that actually many of the artists were thinking, okay, how do we bring the nature inside when we can't bring it inside? But also the other things were questions about navigation. How does the building become something like a city where you recognize where you are by sort of little details, like a shop front or something on the street corner? That's a street corner where you need to turn. And so the works also became something that we were, together with the artists, we were kind of an architects, we were thinking of how do we navigate in the building, and how can the artworks actually become a kind of navigational tools without, in a way, taking away from the art, but actually becoming something that you really pay attention to in your kind of movements in the building. And so this was also kind of taken into consideration when placing these works. And the tiles, this sort of reference to they look like pixels, but they also actually their reference was cross-stitch, and a whole history of actually cross-stitch, and a kind of lady whose name I cannot remember at the moment, but I'll check it out for tomorrow morning for the tour, who actually introduced a lot of this cross-stitch patterns to Finland, and was the kind of really part of this sort of creative communities of intellectuals in Helsinki in kind of earlier 20th century. And then the prints are actually roses from architecture. So these rosarium patterns that Kalle found in different parts of the city, as they come from kind of very, very recent pattern that is used in sort of logos, but also back to Engels' architecture, neoclassical architecture, and those sort of rose patterns that actually have a kind of a long history of influences between Europe and the East, and carry that kind of sense of how our kind of something that is seen as very local as architecture and art or sort of symbolism has a kind of a very long, complex kind of global history. And now I have to run through because I'm already running out of time. But so there's when thinking of the different spaces of where to kind of commission the works, we're kind of thinking of that we want those spaces, and the hospital were sort of emphasizing the places where a lot of people move, what are the places where the art can be encountered by many people, but also of course thinking of what are the spaces where people have to wait or kind of take time, and where the work can really have a kind of have a sort of significance, and so there's this work is in a new cancer hospital by Helena Hietanen and Jaakko Niemelä, and this was kind of something that here you can see it more close. They wanted to bring the light into this very kind of there's quite a tall space with the lights kind of glass ceiling. And they really wanted to bring the light, but also these organic shapes into the building. And in the end, they kind of end up working with this sort of quite sort of square modernist kind of feel of the formal sort of feel of the architecture. And they kind of, in a way, this sort of staircase end up growing into this sort of tree-like structure. And the starting point for this was an old birch tree that they found in a park close by the hospital. And they photographed the birch and ended up actually working and making this pattern based on that. there were some specific spaces that were that were very specific in a way, that was identified early on, that something kind of needed to go there, or was sort of needed in a way in these spaces. Art was sort of desired in these spaces, and this is a kind of a long corridor in an intensive care unit of the hospital. There's no windows in this corridor. It's a very long and kind of winding corridor, and this is obviously a space where the patients are not going to most likely pay much attention to the work, and maybe their visitors will. Their visitors will be navigating through this, but also the staff are the kind of people who actually spend, and ended up being, the staff ended up being very important parts of this process of really thinking of what to make for that, and what kind of work would work in a way in this kind of very also complex space in terms of particularly thinking of the kind of visitors, of the patients. And they were a really fantastic group of nurses who were so engaged, and they felt so, they felt that they felt really valued, and they felt it was so important for them, and of kind of great value, especially after kind of COVID, to kind of feel that there's actually this huge series of 7 wall paintings that were kind of made for this corridor. And Mona Martsuk is an artist who's lived some years now in Finland, but who's from Greek Egyptian background. And we wanted in the process to really think of also who are the future people in Helsinki who will be in this hospital, who are the patients who will come here, and how the demographic of the city is constantly changing, how there will be a kind of we don't know who's going to be in some decades, who will be the biggest demographic of Helsinki, for example. And so we kind of somehow wanted to think of bring in different perspectives from also artists who come from different backgrounds and who have not maybe lived in Helsinki for so long. And I know I'll be quick now. And and so Mona made this. Mona looked at, in a way, with a kind of still a bit of somebody who's just moved to Helsinki, and she was really fascinated by the different public spaces and this sort of real kind of where different kind of demographics of the city meet, and those sort of and have leisure time, but also design, of how she found that there was a Finnish design everywhere, like a classic Finnish design. And she made these sort of murals that are actually printed, and they can be easily reproduced if needed. The nurses were constantly saying, but we have, sometimes in a hurry, we might bump into with a trolley, or bed onto the wall, and so on. So trying to make something that can really easily be also reproduced. And we can't go and visit these works, obviously, with a big group at the intensive care. So I'll show you just a few of the works here. And then a couple of more works really quickly, and I'll tell you more about this tomorrow. This is another work that we can't visit because it's in the chapel, or the space where people can go and where they can have like not the funeral, but the kind of anyway, running out of words now, but where basically families can go and meet the kind of or say their goodbyes. It's not called chapel because it's not a religious space, but we knew for this space that it's a very particular kind of space where one of the only places where we could have textiles, because it's a space that doesn't have to have that sort of hygienic standards, but also a space that is very predetermined what can be there. And we really wanted to have a younger artist to have an opportunity to kind of, for the first time, to make a public artwork. And so this was the kind of, for example, was one of the criteria when we're looking for somebody who works with textiles, who could make this. And this is, and Hele Okkonen's starting point was lichens that are the first, on the kind of rocks on the shorelines of the city that attach to the rock, are able to kind of attach and start building, in a way, these sort of ecosystems. And so this idea of kind of also hope, after something new grows. And there's a kind of 2 different works. And then this is a kind of quiet room that is where Elsa Salonen, her work we can see tomorrow, produced this work that is painted with rocks, with minerals made out of ground rocks that are found all in Helsinki. So she worked together with a geologist and identified different rocks from Helsinki that could be ground into different pigments, and then she made this painting based on that. And the reference to the village elder with the name refers to the rocks that were here, the rocky ground of Helsinki that was obviously here before way before humans. And now I'm really going over time. Last couple of works. This is work still in progress to some extent, because this is a participatory, sort of collaborative project that Della Van Oliver made in a very close dialogue with the hospital staff and the patients of the cancer hospital. And the idea was really to create a digital artwork that will work as a kind of platform for the patients to also share their stories with each other. And this is a kind of, the plan was to make this on tablets that will be in the day hospital with this sort of medical treatment units, where the patients spend hours at the time of an treatment, where they could go back to and actually, kind of in a way, travel in this world, in this collective mindscape, that have these different landscapes that are all created based on different interviews with patients who basically kind of describe these sort of sanctuaries, and then also these darkest spaces of these sort of different emotional spaces. And then they come with narratives that people can also, when navigating the space, the other patients can also hear this, if they choose to do so, these stories from others. And we have this now as a kind of on a screen, where you can use it in this sort of like a lounge area, and the tablets are still in development. And last but not least are two young artists who were commissioned to make series of prints, print artworks that would be, because we've got 150 rooms, like patient rooms for single rooms, and we wanted to have a unique artwork in each. But 150 is quite a lot. And so I proposed in the end that we would have a couple of printmakers actually make a series of prints that say that there's a kind of there's a number of, there's like 5 or 6 in each series, and they are, so there's a kind of uniqueness, there's a different, there's 5 or 6 different works that are then spread across in the different rooms. And in these waiting areas, you can see the kind of, you can see these sort of combinations of those. The artist made also these combinations of this series into the waiting room area. And there's Mina's works that took their starting point as different feelings of safety in different kinds of spaces, urban spaces, coming from a library, from the seaside, and actually translated this into these abstract images. Or Suvi Susi, who took actually different memories of places of significance to her, and the light, and those sort of reflections and visual kind of memories of light in these different places. And these were the kind of, as you can imagine in all of these works, there was a lot of thinking around what on earth can, especially in that space where patients are lying and they will have to stare at this, for a few days potentially. So to think of like kind of how to make something that can kind of in a way be a space that allows you something to look at, to focus on, but also kind of hopefully also kind of brings mainly this sort of positive associations. Thank you so much for your patience, especially Aino, because I know that you're keeping time for us really carefully.
Thank you so much, Taru. And unfortunately, we're a bit late now, so I suggest that we can continue the discussion tomorrow, as you will be conducting
exactly.
there. Yeah. So thank you very much. Very insightful. Now, I'm welcoming a duo, Finbar Kruk-Rosato and Riccardo Atienza. Finbar is a project manager at Region Stockholm's Cultural Administration, where he has worked with the production of artistic commissions for healthcare environments for the last 10 years. With a background as an artist and curator, Kruk-Rosato has previously worked with the exhibition production for a number of Swedish art institutions and with a number of self-initiated curatorial projects in Sweden. And Riccardo Atienza is an architect, researcher, and sound artist. With a background in architecture, Atienza has focused on an interdisciplinary approach to working with sound in various public contexts and in the wider field of contemporary art. Previously a lecturer and researcher at Konstfack in Stockholm, Atienza is currently an associate professor in sound art at the Department of Art and Media here at Aalto in Espoo, which is great. So Finland, welcome, the stage is yours.
Thanks very much. It's a real pleasure to be here. It's been really inspirational so far, so I hope that we can add something of interest to the day. I've got a lot of slides. I'm going to go through them at quite a steady pace. I just wanted to initiate this with just giving some background about, the context within which I work. Region Stockholm is a large administrative organization that takes care of issues to do with healthcare and public transport, but also culture. So I work for the cultural administration there. And as Aino was saying, I work with production of public artworks. This art enriches citizens' experience of healthcare environments and public transport is something of a motto or a mantra that kind of goes through what we do within the region. We operate along the percentage rule, which means that whatever public money is made available for renovating or building new hospitals, a certain percentage of that goes then to the purchase of new works of art or the production of site-specific works of art. I don't know how massively interesting this is, but it gives you some kind of idea about the logistical and bureaucratic processes that we work with. So we have a political organization that gives us, a mission, I suppose, but then we also have other organizations that give us our actual formal tasks in terms of, the artworks or the art projects that we are to work with. And then we have a number of different processes for creating new works and also for the maintenance of old works. And then we also have, lastly, the different environments, the different groups of people and staff who are then, to take ownership of these works of art, as it were. What I reflected on previously was that a great deal of what Laura and Taru were speaking about in their talks and presentations, a lot of it is. Then you get I sort of give a very, very good picture of about the process that we work with as well, which is really beneficial for me. I don't have to go into a lot of detail about that because they've already painted up a very good picture about how these things work. But these are just a number of examples of the different kind of situations that we find ourselves in. Some of them are quite similar to what you've already seen in the previous presentations. A lot of the time we're working to very specific briefs as well in terms of the size of the space or indeed, the nature of the healthcare situations that we find ourselves in. For instance, this work here has been produced really solely in accordance with hygiene demands from a healthcare department, which needs to have 100% sterility of all furnishings at all times. And then, of course, we work with these large, quite dominant pieces where we try to kind of do something with the architecture, create something with, specific with the space. So this kind of paints a picture, I suppose, very briefly about the different kinds of environments that we have, how we work, trying to use different materials, working with textiles, and for instance, in this picture to the left, with a very large gobeleng, very large textile piece, but also working a lot with ceramics and so forth. Here's a specific answer to the problem about how to work with murals, for instance, today when these issues are difficult in terms of future maintenance, where we have worked with the idea of a mural but on glass sheets. We also work with a lot of different collections of different kinds of works. We also work in the public transport system with temporary artistic interventions, temporary exhibitions that are changed on a yearly basis. And also within our department, we have quite a new organization which works with broader issues to do with arts and health, where we step outside of this specific production mandate that we have and support different initiatives within healthcare for about how arts and culture in a broader sense can be brought into healthcare situations, to benefit patients. For instance, how dance and choreography can be brought into and utilized in psychiatry. So that kind of brings me up to this. This is our focus today, Ricardo. We were given quite a strange question by the ambulance service a number of years ago, which was, well, can we have art in these ambulances? Quite an odd, an odd situation really for us to get the question, but once the question was kind of nuanced and described, well, then it made a certain kind of sense. The ambulance service see that the rooms that they have in these vehicles, there's 90 ambulance vehicles of varying sizes, either this size or the smaller sized ambulance that you saw in the image previously. They see these as a mobile emergency room. So they see them as a very specific type of architectural space, as it were. And so then the question comes, well, can we have art in these spaces? Not an easy question to answer. We felt that we needed to take probably a lot more time to answer that question, than we would do in other situations. We have our routines for how we work with art in built environments, but this is an entirely new kind of challenge. So we spent quite a long time doing this specific pre-study, speaking with a great deal of stakeholders, different people who are involved, different people who should have their voices heard in these particular situations. Doctors, representatives from patient interest groups, research in the field of health science, and artists and researchers. So this was important to kind of, to broaden the idea about, to get almost actually to get away from this question of, can we create an artistic commission for the interior of an ambulance? Well, after we had widened all that out, then we kind of narrowed it down to another question, which was, how can we contribute to stress reduction for staff and patients? And then when we start from that question, then we go into entirely different kinds of territory. It was something Ricardo and I were just speaking about, was that in many of these situations where we're working with artistic commissions, a lot of the, there's a lot of things which are, there's a lot of strictures, there's a lot of things that are, that define what you're going to do. In this case, the only thing that we were certain of was the space. But anything else to do with medium, anything else to do with how we were going to do this was completely open. So it led us, during the pre-study, of which Ricardo was a part, we came down to kind of building this pilot project that we've been working on 3 different columns, I suppose. So we started looking at issues to do with lighting, issues to do with visual and tactile stimulus, and issues to do with sound. And that's where Ricardo comes in here. I'm going to leave it over to him for a few minutes so that you can speak in a more qualified manner about the issues to do with the sound work.
Oh, okay. Thanks a lot for this introduction. Yeah, as Finbar was explaining, we were not called in as sound artistic specialists, more as an architect in my case, perhaps as a curator for Robin's case, so a colleague I have been working with for this project. And I think that's quite important to say. So there was no specific medium. I think that's really a key idea. Well, that's just like the introduction. So I would like to start here, which is, it relates to what you were explaining. So this idea of we need to understand which are the needs and how can we contribute to improve these complex and stressful environments for patients, for staff. So we started with a number of workshops that were organized with staff members, just trying to understand how could we intervene in these spaces. What are we talking about? Which kind of, is it a material, immaterial? Of course, we were all coming from different disciplines, artistic habits, we could say. We have our tools, but we were really open to just understand how can we transform the experience of this space, perhaps through minimal interventions. So this is really the starting point for our contribution at least. And well, sound was one of these elements that came as a potentially transformative element. And we were working in this way after some analysis, understanding which kind of sonic environment we were facing, working with 3 different layers. We first understood that it was an environment that was very low frequency based. So there has been a lot of work done on the isolation and descapping, but this means that still low frequencies, vibration is passing through, not the rest. So you get this very strange, weird feeling of low resonances. You are vibrating, but you don't hear it, but you feel it. So one idea was to work with this bump, some sort of reaction that could provide or give some color to this vibration. The second layer is based on this idea of attention masking. Maybe I can just go directly to the 3 of them to be very quick. And I'm really even jumping over this one, just to focus on the main ones. And the main one, I would say, is this background ambient texture. And this is based on some sort of co-creative, it's a collaboration with staff members. So we are providing a number of materials that they are invited to play with and try to design the sonic atmosphere they believe could be best suited for different situations. And this is done within the ambulance itself, along like some rides. So for now it's a prototype. So what you can hear is the first kind of approach to this question. And it works in this way that they are confronted to this graphic interface and they are asked to produce their best sound, sonic texture. So they intervene, they can select a number of materials and operate on a number of filters to get a specific texture, essentially. But they don't need to understand, so just to play around and listen, and also get a game. I'm just jumping quite quickly because I know that the time is limited. And the third layer, so the first layer was just reactive, automatically reacting to bumping. Second is like an interactive, so the staff designing for now for understanding which could work best. And the third layer.
Should we play that at the end? Because we've got, I've just wanted to interrupt you because we have,
sure.
On the next slide there's a number of clips, but at the end you can hear the way that the harmonizations are, you know, it's a good illustration of it, I think.
Exactly. So we understood that it was also a very important element to take into account the siren of the ambulance, which of course is very present. I don't even need to explain how relevant that is. And this siren, in the case of Stockholm ambulances, it has like 3 different sounds that you will hear later on. So we were lucky enough to collaborate with Stockholm Philharmonic Orchestra to harmonize somehow these different sounds for trying to transform the way patients inside and staff could perceive these very stressful sonic textures. And as Finbar was explaining, we will listen to that through the final video. Yeah. So we just jump to it. Just to say that regarding the sonic part, we have written an academic paper for a conference. So if someone is really interested in just digging into this material, we are very happy to share that material later on. So we just will it allow us?
Yeah. Do you want to?
Yeah. Well, maybe some final comments. So as I said, this is a prototype. We wanted really to understand the potential of these ideas, how good they work. And now we will start, it's already going on, an evaluation phase with staff members, hopefully patients. We have to understand exactly in ethical terms how that will work. We were talking about ethical committees this morning. I suppose there will be a lot of that coming. And it's, of course, that's a very important element for us, a co-design process. So, of course, it's totally irrelevant if we are not able to involve people working in this environment. It's interesting that we started always thinking in terms of patients, but then along the process we understood that probably staff is even more important as they are the ones spending there many hours a day. And they were in fact even quite skeptical at the beginning. And through this collaboration, I think these ideas have really made their way. Well, we're learning a lot along the process, as you can imagine. And well, we got some results, but again, it's really like we are on an initial phase, really trying to understand the potential of these ideas. And then I pass it again to Finbar. Thanks a lot.
Yeah, I think that Ricardo has given in a very short amount of time, given a really good picture of the complex work that you and Robin have done with the sound aspect of this project. We've also worked with, as I mentioned previously, visual art and I suppose visual and tactile experiences. So we employed the artist Pia Sandström to work on that aspect of the project. A great deal of the way Pia worked with this project was completely in line also with how Robin and Ricardo did, which is based on the process of co-designing things. So her process was not to sit in the studio and to devise ideas, but to actually travel along with ambulance staff, discuss things, have an open conversation, an associative conversation almost, just to bring up as many ideas as possible, and then to take those ideas and to visualize that in some way. So really in practical terms, the best way to deal with these kind of things in an ambulance environment is also there is really only one way of doing it, from a logistical point of view, which is we use these printed images on plastic foil. It's hygienic, it's quite tough material, so you don't end up with a lot of wear and tear. So these were then applied to the walls, to the ceiling, and to the windows. And you get a lot of light filtering in, you get a lot of play of light on these different surfaces. That's a quick glimpse of how that looks, but there's a video piece that we can show at the end here, and then you maybe get a bit of a better idea. P also worked with these tactile objects. We were told by the ambulance staff that a lot of worried patients want something to hold on to. So we've created these silicone stress balls, which thematically linked together with a lot of what Pia was doing in terms of the idea of prisms, the idea of filtering of light. The practical issues to do with lighting were pretty large in the ambulance vehicles. The lighting, the existing lighting was pretty horrible. It was this it's incredibly strong white LED lighting, but which also flickers. So in the long run, you're probably going to end up with a migraine from working in this environment. So we brought in 2 architects who specifically work with lighting issues. And they created a number of alternatives to how the lighting in the space should look. So they gave us these design briefs, and then towards the end of last year, we then, together with the staff, we decided about how best to place them, and then we did quite a provisional kind of installation process with them. So we have, instead of, let's see if I can, see if that works. No. So instead of these very bright white spotlights, what we have instead is warm lighting strips, which are indirect as well. So the lighting isn't coming down directly onto the patients, but instead bouncing off the walls. We also introduced nothing really to do with an art project, but just listening to the ambulance staff and talking about their needs, we introduced these flexible spotlights, which are then used really solely in medical interventions. So there was a lot of positives that came out of this, just in terms about how we can push, what it is to work with an art commission, but also about how far we can step across really our mandate as well and help, this particular, the ambulance service in this case with different problems and different issues that they have. So it's an incredibly interesting co-design process for our part. I'm aware of the time, but I do want to show this video. So this gives you an idea.
The ambulance service in Greater Stockholm and Region Stockholm's cultural administration started a collaborative project in 2022 to explore the possibilities of working with artistic commissions in ambulance vehicles. The ambulance service described their work as being equivalent to that of an emergency department, the main difference being that their reception rooms are mobile. Working with artistic commissions in an ambulance is a different kind of challenge than creating art for built environments and hospital wards. The ambulance is a completely different kind of room. A preliminary study has been produced with voices from various experts and interested parties. This has led to a pilot project in which artists, composers, and architects participated. Based on an examination of how the environment in the ambulance affects both patients and staff, the project focused on 3 areas for development, where artistic research and knowledge could contribute to improvements, such as lighting, sound, and visual and tactile experiences. Architects Rodrigo Muro Avendano and Foteni Kyriakidou created a lighting proposal. Spotlights that gave a cold and harsh light were replaced with warmer indirect lighting. Specifically selected lamps replaced existing ones to minimize flicker that can be detrimental to health. The warm and even lighting brings a certain harmony to the space. The artist Pia Sandström used a number of surfaces to present artistic images. A surface in the ceiling, a wall, and 4 windows have been covered with printed images on plastic foil. The images present different colors and textures: green foliage, painted wood, folded paper, and short poetic combinations of words. The images also capture the light in different ways. The artist has also worked with tactile objects made of silicon as stress relief. Composers and artists Robin McGinley and Ricardo Atienza have created a programmed soundtrack and a number of musical compositions based on the unique environment of the ambulance. The vehicle's well-insulated construction creates a quiet environment, but where low-frequency vibrations from the road are an unavoidable and dominant sound. A specifically designed soundtrack, consisting of higher frequencies, creates a more balanced soundscape in the space. A mixture of elements such as lapping waves, rain, white noise, and soft resonances. When the sirens are in use, musical compositions are activated, which are played at a low volume inside the ambulance. These pieces of music take the rhythm and melody of the sirens and embed them in orchestral music. The recordings were produced in collaboration with the Stockholm Concert Hall and the Royal Stockholm Philharmonic Orchestra. It is impossible to completely hide the siren sounds, but it is possible to give them a harmonious musical setting.
I'll end it there. There's the link to the film. A lot more to be said, but there we go.
Thank you so much, Finbar and Ricardo. I'm afraid we are a bit late in our time, so but before we go to our coffee break, I would like to introduce you to the group works, which is very important since we want to create this network for art, hospital art. But yes, let's give a big applause.